much sleep are you getting each night on average, would you say? Okay. That's not terrible, but it's not amazing either. And your diet, what is your diet like? Okay, yeah, I see. Do you exercise? Okay. Do you drink? Sometimes. How often? Okay. Do you smoke? Okay. Do you have any medical conditions that I should be aware of? Okay. And do you use any medications? Okay, and that is for the... Yeah, okay, I see. Okay. Now. I'm gonna start by just taking your temperature. I'm gonna take your temperature, okay? So if you could open your mouth wide for me, please. I'm gonna place this under your tongue. And close your mouth. Okay, you don't have a fever, so that's a very good start. That's a very, very good start, okay? I'm now gonna have to put on some gloves. I'm gonna put on some gloves because I have to feel your face a little bit, just a little bit. And I need some hand sanitizer. Okay. And now for your knees, relax your knees, okay? Very good, very good, very good, very good, very good. That's so good, that's so good. Now I'm gonna listen to your heart. Just try to breathe normally for me. Okay, so your heart rate seems okay, but it's a little bit fast. Are you nervous? Yeah, I understand. Just try to relax as best as you can. Take deep breaths, okay? Now can you turn around? I'm gonna check your lungs. I'm gonna listen to your lungs. Okay. Now breathe in with your nose and out through your mouth. Very good, very good, very good. Very, very good. You did amazing, you did amazing, you did amazing. I'm going to be taking your blood pressure. Can you reach out an arm for me? Yeah, it doesn't matter which arm it is. Okay, thank you. And now it's very, very important that you sit still and relax and just try to feel comfortable, okay? You're doing amazing, you're doing amazing. Okay. So that's really, really good, that's really good. Perfect. That's perfect, that's perfect. Now I'm gonna check your oxygen levels. So can you reach out a finger for me? Yeah, I'm just gonna place it there. I'm just gonna... Let's see. Okay, that's very good, very good. You have enough oxygen in your blood, which is always a good thing, okay? Now I'm gonna be testing your hearing. So I want you to close your eyes. And I want you to tell me which side you hear the glove sounds on, okay? Close your eyes. What side? Good. 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 Very good. Now I have some scissors. And I want you to tell me with your eyes closed if the sound of the scissors are moving closer or further away from you, okay? Is it moving closer or further away? Okay. Closer or further? 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 Very good, very good, very good. You did exceptional, Now I would like you to follow my finger using only your eyes. Yeah, don't turn your head or move your head at all, just use your eyes. And I want you to just follow my finger, okay? Very good. Now look at my nose, and tell me which side is moving. Good. you puff out your cheeks? Good, can you smile? Very good, very good, very good. Now I want you to close your eyes like this, and I will try to open them, but you will try to resist, okay? Very, very good, very good. Now I want you to keep your eyes open. I will try to close them, and you will try to resist, okay? Very, 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 very good, very good, very good. Okay, now I'm gonna remove my gloves. I'm gonna be testing your sense of smell, okay? So here is the first one. I want you to smell this. What does it smell like? Yeah, it's nail polish remover. Not a very pleasant smell. But you did it okay. You were right. You did very good. And the next scent is this. What does it smell like? Yep. It's peach. And the next scent is this one. What does it smell like? Yes, it's mint. Very, very good. And now for your sense of taste, I want you to take a sip of this. Take a sip. Okay, what does it taste like? It tastes like caramel. Yeah, that's correct. Really good. And now for this. Take a sip. What does it taste like? Chocolate. Yes, you are right, it's chocolate. And now for the final one. What does this taste like? Take a sip. Yeah, you're absolutely correct. It is vanilla. Okay, so we are done with the exam. I'm just going to write down the results. Overall, you seem very healthy. The only thing I'm noticing is that you have some dry skin. And some chapped lips, and your heart rate is a bit high, which could indicate that you are a bit dehydrated. So it's very, very important that you drink a lot of water, okay? Yeah, you can have some water right now. Take a sip. Good. Drink a lot of water, and I have this for you to take home. You can apply this to your chapped lips or any other dry spots, okay? It's very healing. It's very, very healing. I can put some on your lips right now. Perfect. Okay, so here you go. And I hope to see you again in a year for a new checkup, okay? But for now, have a wonderful day, or a good night, wherever you are in the world. Hello, and welcome into the cranial nerve examination. So first I just need some information from you. What is your first and last name? And your date of birth? And your address? Okay. And can I have a good phone number for you? Perfect. So In today's exam, I'm not going to be using any tools. I'm just going to be using my hands, my voice, and do a couple of tests. But first, I would like to do some breathing exercises with you because you look a little nervous. So just breathe in through your nose. Hold, 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 and out through your mouth. Again. And one more time. Very good, very good, very good. Now I would like you to follow my finger, okay? Just follow it wherever it goes. Very good, you're doing amazing. Okay, now I'm gonna test your peripheral vision. So just tell me when you look at my nose, and tell me when you can see my fingers wiggle, okay? Good. 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 Perfect. Very good. You're doing amazing. Yes. Okay, perfect, perfect, perfect. Okay, so now I'm gonna be touching your face. I want you to close your eyes. Close your eyes. And I'm just gonna be touching your face with my finger. And I want you to tell me where I'm touching you, okay? Okay, good. Yes. Cheek, yes. Other cheek. Chin. And nose. Very, very good. Now I want to be testing your facial muscles. So first, can you raise your eyebrows for me? Good. Can you furrow them? Very good. Now can you squeeze your eyes shut? Squeeze them, squeeze them, squeeze your eyes shut. I'm gonna try to open them and don't let me. Very, very good, okay. Now can you wrinkle your nose? Good, now puff out your cheeks. Okay, now show me your teeth. Good, and stick out your tongue. Move it side to side. Good. And now can you frown? Perfect, perfect, perfect. So now I'm going to be performing a quick hearing test on you. I want you to close your eyes and let me know which side you can hear my fingers snapping on, okay? Okay. Good. Good. Yes. 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 Perfect. Very, very good. Very good, very good, very, very good. Now I'm gonna be whispering some words into each ear and I want you to repeat them back to me, okay? Okay. Blue, blue, blue. Ocean, ocean, ocean. Moon, moon, moon. Good, 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 good. Feather, feather, feather. Window, window, window. Candle, candle, candle. Yes, that's correct. Very good. Now can you open and close your mouth for me? Just checking your jaw movement. Open and close. Good. Now can you move your jaw side to side? I'm just gonna feel your jaw. Move it side to side. Very good. No clicking. Is there any discomfort with that? No? Okay, perfect. Now can you shrug your shoulders like this? I'm gonna try to press them down and don't let me. Okay. Good, good, good. Good. Now move your hand against my head. Turn your head against my hand, I mean. Turn your head against my hand. Good. Now turn your head against my other hand. Very good. So your strength in the neck muscles and jaw muscles and all that seems to be in good shape, which is amazing. Okay, now I want you to first touch your nose and then touch my finger, okay? Touch your nose and then my finger, okay? Okay. Touch your nose, touch my finger, 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 touch your nose, touch my finger. Okay, you did very well on that too. And now, let's see, I think we're gonna do one final test. And it's gonna, yeah. So I want you to tap your fingers together like this on each side, okay? Yeah, like this. Okay, can you do that for me? Okay. Very good. And now the other hand. Perfect, perfect, perfect. Okay, so that's it for this exam. Are you still a little bit stressed out? Do you want to do another breathing exercise? Yes? Okay. So just breathe in through your nose. Hold it. And breathe out. One more time. Good. Are you feeling relaxed now? Good. I'm just gonna take some final notes since I couldn't find anything wrong. But I think it was good of you to have this cranial nerve exam just to make sure that nothing's out of the ordinary, okay? Okay. Perfect. Thank you so much for coming in, and I hope you have a wonderful day or a good night wherever you are in the world. Okay, goodbye, 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 goodbye. Hello and welcome in for your medical exam. So I'm going to be testing a lot of different things today, and I just want to check that you are in good shape, okay? But first I'm gonna need to take some information from you. So what is your first name? Okay. And your last name? What is your date of birth? Okay. And your home address? Okay. And what is your phone number? Okay. So I'm just gonna start by asking you some general questions about your health. So how are you feeling nowadays? Do you have any symptoms or any issues, any complaints? Okay, yeah. Okay, I see. How are you sleeping? You're sleeping, okay. Well, you could definitely benefit from more sleep. And what is your diet like? Okay. Yeah, not too bad. Just remember to include your fruits and veggies, okay? Especially leafy greens and those things. Do you get any exercise? Yeah, any physical activity is included. Okay. Perfect. And how would you say that your mental well-being is? Okay. Yeah, I see. Okay. Okay. And do you want a flu shot today? You would like a flu shot? Okay. Perfect. So let's get started. I'm gonna start by putting on some gloves. This is going to be quite a comprehensive exam since it's been, let's see, yeah, it's been quite a while since your last visit. Like so, and some hand sanitizer, obviously. Okay. So I'm going to start by taking your temperature. So can you please open your mouth for me? Thank you. And I'm going to place this under your tongue. Now close your mouth. Okay. Okay, so that's a good start. You don't have a fever. Now I'm gonna be listening to your heart and your lungs. Let's see. Okay. So I was wondering if I could pull down your shirt slightly. Thank you. And I'm just gonna listen. Just breathe normally. Okay. So your heart sounds normal. You have a bit of a fast heart rate, but it could be because you're nervous. Are you feeling a bit nervous about today's visit? Yeah, that could be it. Now I'm gonna listen to your lungs, so if you can turn around for me, please. Thank you. And I'm just gonna pull up your shirt a bit. And now I want you to take deep breaths in through your nose and out through your mouth, okay? Okay. Like so. So your lungs also sound fine. Yeah. I'm just gonna take a note of that. Yeah, you don't seem to have any obstructions or any mucus of any kind that is interfering with your breathing. So that's a very good thing. Now I'm gonna check your oxygen levels. So I'm just going to be placing this on a finger. If you can reach out a finger for me. Thank you. Okay, let's see. Let's see. Okay, very, very good. You have 99% oxygen in your blood, which is perfect. So we're off to a very good start. You are doing wonderful. You're doing so good, so good. Now let's take your blood pressure. So I have this cuff that I'm going to be placing around your arm. Let's see. Do you have a preferred arm? You can take this one, yeah. And I'm just gonna start, and now it's very important that you relax, okay? Yeah. Just relax, relax, relax. Okay. Okay, so your blood pressure is completely normal. Yeah, do you struggle with any dizziness or when you stand up? Okay, sometimes you get dizzy when you stand up. That's very common. Yeah. It's called orthostatic hypotension. And it's nothing to worry about as long as you don't pass out. Do you pass out or faint? No? Okay, good. Okay, so I thought I just should give you your flu shot now. I have the flu shot all pulled up. So I'm gonna inject it into your arm. Let's do this arm. Okay. Perfect. That wasn't scary, was it? No? Not scary at all? Okay, I wanted to take a closer look at your face, if that's okay with you. Yeah, just to feel your face a bit and see if there's any lumps or bumps, any scars, bruising, wounds, anything like that. Is it okay if I touch your face? Okay, thank you. So I'm going to be very gentle. Just tapping on your forehead. Let me know if anything feels uncomfortable or painful, okay? Yeah, perfect. Is it okay? No pain? Good, good, good. Just feeling your cheeks. and down your nose. Okay. And your jawline. Can you tilt your head back slightly so that I can feel for your lymph nodes? Thank you. I'm just checking if there's any enlarged lymph nodes. And let me know yet again if anything feels painful, okay? Seems normal. Okay, can you tilt your head forward slightly so that I can check your scalp? Okay, thank you. Okay, seems okay. I also want to look at your face with my light here. Yeah, just to get a closer look at your face. Just look at every little detail. Don't look directly at the light, it can be very bad for your eyes, okay? Can you turn your head that way for me? That way, thank you. Okay, and the other way, that way, thank you. Okay. And your scalp. Okay, yeah. You can look straight forward again. Perfect. Thank you so much for cooperating so well. It makes my job a lot easier, okay? Now I'm going to be testing your reflexes. So I want you to just relax your arms and legs, okay? And I'm going to be very gently tapping with this hammer to see if we can get a reflex out of you, okay? Good. So I'm starting on this side, okay? Yeah. Okay, good. Now the other side. Very good. And now your knees. Relax your legs, relax your legs. Perfect. Other side. Okay. Amazing. Amazing, amazing. Okay, so now, let's see. I think I want to take a peek into your ears. So I'm gonna be using this light. And I'm just gonna be looking into your ears. Okay. And on the other side. Okay, so you have a bit of build-up from earwax. We can fix that. I'm just gonna apply some oil to your ears. That's gonna soften your earwax before we remove it, okay? So first on this side. Okay. And on the other side. Okay, perfect. And let's wait for that to work for a few moments. While we wait for it to work, I want to have a peek into your nose. So can you tilt your head slightly backwards? Thank you. Just gonna have a small peek, a little peek up your nose. Okay. Yeah, it looks normal. And now I want to look into your throat. So if you can open your mouth for me. Thank you. And say ah. Okay. Very good. Now I want you to swallow while I feel your throat. Good. Now swallow again. Very good. Okay. Now let's remove that earwax. So I'm going to start on this side. Okay. And the other side. Perfect. And now I'm just going to have a look again into your ears just to see if we got everything. So I'm going to use my light. Okay. On the other side. Perfect. Perfect, perfect. Perfect. Okay. Now I'm going to check your eyes. So just look at the wall behind me while I take a look with my light, okay? I'm just gonna... Okay. Okay. Very good. Your pupils are dilating and contracting as they should, so no problem there. Now I would like you to follow my finger, okay? Using only your eyes, don't move your head at all, only use your eyes, okay? Very good. Now I'm going to hold up my fingers and I'm going to move one side, and I want you to look at my nose and tell me which side is moving, okay? Good. 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 Very, very good. 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 Perfect. And now I'm gonna check your peripheral vision. So if you can let me know when my fingers leave your vision, okay? Good. 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 Perfect. Now let me know when my fingers enter your vision, okay? Good. Perfect. Yes. Amazing, amazing, amazing. So your eyes, they seem to be in very good shape. Okay. And now I'm going to ask you to do a couple of things to check your facial muscles and the nerves involved in your face and your facial facial muscles. Okay. So first I want you to raise your eyebrows for me, like so. Good. I'm just gonna feel. Okay. And now I want you to frown. Okay. Very, very good. Now I want you to smile for me. Nice big smile. Just come. Okay, and puff out your cheeks. Keep them puffed out. I'm going to try to... Okay, very good. Now I want you to raise your shoulders, like so, and I'm going to try to press them down. You are going to try to resist, okay? Perfect, very, very good, okay. Now close your eyes, close your eyes, close your eyes. I'm going to try to open them and you are going to try to resist, okay? Good. Good, again. Good, okay. Very good, so no problem there. I'm just going to be taking a couple of notes. Okay, so I'm going to be testing your hearing. I want you to close your eyes again. Close, 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 close your eyes. And I want you to tell me how many times you hear this sound. Okay? How many times? Good. How many times? Yes. How many times? Good. How many times? Yes. How many times? Very, very good. I'm also going to check something else. I have 2 pens here. I'm gonna hold 1 pen on each side and I want you to tell me which side you can hear the clicking on. Okay, close your eyes, close your eyes. Which side? Good. Which side? Good. Which side? Perfect. Which side? Good. 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 Perfect. Perfect, perfect, perfect. Now I'm going to be checking your sense of smell. So I'm going to be taking these Q-tips here, or 1 Q-tip, and I'm going to spray a solution on the Q-tip, and I want you to smell it. Okay, smell it, smell it, smell it. What does it smell like? Yes, it's coffee. It's coffee. You are correct. Okay, let's do another one. Take a new Q-tip. Okay, smell it. Smell it, smell it. What does it smell like? Mint. Yes, that's correct. It's mint. And now let's take another Q-tip and the last solution. Okay, smell it, smell it, smell, smell, smell. Yes, it's citrus, correct. It's citrus. Okay, very, very good. So now I'm gonna examine your sense of taste. So I have this, and I want you to take a sip out of it, okay? Okay. What does it taste like? You're correct, it's vanilla, vanilla, vanilla. Very, very good. Very good indeed. And now I have another one. So I want you to take a sip. Okay. What does it taste like? Salty caramel. Correct, correct, correct. And the final one. Take a sip, take a sip. What does it taste like? Yes, it's chocolate. It is chocolate. Chocolate, 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 chocolate. Okay. One last thing before we are done. I'm gonna test your sense of temperature, so I want you to close your eyes. Close your eyes and let me know when you can feel heat, okay? No, I'm not gonna burn your face, I'm just gonna, just let me know when you can feel the heat, okay? Very good. Again. Very good. And one last time. Perfect. Perfect. And I have one last request, and that is if I could take a sample, a DNA sample from your cheeks. We are just doing some research and it will really help us out. Perfect, thank you. So, open your mouth for me and I'm just gonna swap your cheeks. And the other side, swap. Perfect. And I'm just gonna put it in this sample box. And send it in for analysis. Okay, so you are done. I'm going to write a complete report, and there's really nothing to worry about. You seem to be in very, very good shape. Just make sure to take care of yourself, get enough sleep, do things you enjoy. Yeah, don't isolate too much. Get some fresh air and try to eat somewhat healthy and move your body a bit, okay? Yes. Okay. And if you ever need to come back here, there's no problem. Just book an appointment and I will see you again, okay? So take care, okay? And I hope you have a wonderful day. A wonderful day, or a good night, wherever you are in the world, okay? Goodbye. Hey, hello. I'm Dr. Cami. It's nice to meet you. So what brings you in today? You just want a checkup? Yeah, I can give you a checkup. Do you have any specific complaints? You have some neck pain? Okay. Anything else? No? Okay, so I'm just going to do a basic general checkup of you to make sure that you are good to go. Okay? Perfect. So I'm going to start with just taking some information from you. So what was your first and last name? And can you confirm your date of birth for me? Thank you. What is your home address? And the zip code? And a phone number? Okay. Do you have a preferred emergency contact? Okay, what's her name? And what is her phone number? Perfect. So I'm just going to start with examining your face a little bit, okay? Okay, so just let me know if anything is painful or uncomfortable. Okay, I'm gonna have to get a bit close. Checking your forehead. close your mouth. Let's see. Okay, so you don't have a fever. That's good news. That's very good news that you don't have a fever. Okay. Now. I'm just going to be checking your heart and your lungs. I'm going to start with your heart. So if I could just pull your top down just a little bit. Thank you. Okay, perfect. Can you turn around so that I can listen to your lungs? Thank you. I'm just going to pull up your shirt just a little bit. Now take deep breaths in and out. Very good. Okay, so now I'm going to check the oxygen levels in your blood. So can you please reach out a finger for me? Thank you. Okay. It looks good. Yes. And now I'm going to take your blood pressure. Can you reach out an arm? Yeah, it doesn't matter which arm it is. Okay, now relax and just try to sit as still as possible and just try to feel comfortable, okay? Okay. as well. I think you are in perfect shape. You are in perfect shape. And the neck pain, you can do something about it. You can do neck exercises. Yeah, just Google it. Just Google it. Yeah. Okay, so we are done now. I'm just going to write down the results from the exam. Okay, thank you so much for coming in. Thank you for coming in. I hope you have a good night or a good day wherever you are in the world. Hey, welcome in. Are you here for a medical exam? Perfect. I'm Dr. Cami. Nice to meet you. I'm just gonna have to take some quick information from you. So what is your first and last name? And what is your date of birth? What is your home address? And the zip code is perfect. What is your phone number? And do you have a preferred emergency contact? And their name is... Do you know their phone number? Okay, perfect. Yeah. Good. Now I'm noticing that you have a small wound on your forehead. What happened? You fell and hit your head. Okay. I would like to clean out the wound for you if that's okay. Yeah? I'm first just gonna sanitize my hands. And then I'm just going to be using some cotton to disinfect the wound. Perfect. Very good. Now I'm going to add some tape to it, just so that it stays clean. There we go. Now I would like to just ask you some general questions about your health. So, how is your sleep like? How are you sleeping at night? Okay. Yeah. How much sleep would you say you're getting each night on average? How many hours? Okay. And what is your diet like? Okay. And do you get any exercise? Okay. A little bit. Good. Can you please step on the scale for me? It's over there. Thank you. Okay, so no changes in weight. Okay, I think because of the wound on your head, I'm going to have to refer you to an MRI scan, just to make sure you don't have any serious head injuries, okay? So I'm gonna be writing it right now, so that I don't forget, okay? So you fell and hit your head. Does your head hurt? A little bit, okay. So you are going to get an appointment quite soon, okay? You are prioritized, okay? Very good, very good, very good. Now I would like to take your temperature. If you could open your mouth, and I'm going to place this under your tongue. Okay, so you don't have a fever, and that's always a good sign. Okay. Now I'm gonna put on some gloves. I'm just gonna be examining your face a bit, looking for any lumps, bumps, any scarring, dry skin, any wounds. I see the wound up here, but otherwise I can't really see anything abnormal. Checking your forehead, down the sides of your face, your nose, your cheeks, your chin. Can you tilt your head forward so that I can check your scalp? Thank you. Have you been noticing any itching in your scalp? No? Okay. You have a bit of dandruff, but nothing abnormal. Okay, now can you tilt your head backwards so that I can check your lymph nodes? Thank you. Okay, very good, very good, very good. It seems normal. Everything seems normal. Now I'm going to be listening to your heart. So try to just stay calm and relaxed and breathe normally, okay? Okay, it sounds okay. Your heart rate is a bit high. That could be because you're nervous, okay? Now can you turn around and I'm going to listen to your lungs. I'm just going to have to pull up your shirt slightly. Take deep breaths in through your nose and out through your mouth. Very good, very good, very good. So all of that sounds normal, completely normal. You have a healthy heart and you have healthy lungs. Okay. Now I'm gonna be taking your blood pressure. So I'm just gonna be adding this cuff to your arm. And it's very important now that you just sit still and relax, okay? Let's see. Okay, so your blood pressure is very good. It's perfect, just the way it's supposed to be, Now I'm going to be checking your oxygen levels. Can you reach out a finger to me? Thank you. And I'm just going to place this on your finger. Okay, all good. Now I'm gonna have to feel your abdomen, so if you can lift up your shirt a bit to me. Thank you. I'm just gonna be palpating very gently. Let me know if anything feels painful. Any pain, any tenderness, any discomfort? No? Okay, very good, very good, very good. Okay, so what I'm going to do now is I'm going to check your eyes. If you can just look at the wall behind me, I'm going to be shining a light into your eyes just to check if your pupils are dilating and contracting as they should, okay? Very good. Okay, I'm gonna also check with a brighter light, okay? Very good. Everything seems normal. Everything seems normal. Now I would like you to follow my finger only with your eyes. Don't move your head, only your eyes, okay? Very good, very good, very good. Now look at my nose, and tell me which side is moving, okay? Good. 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 Perfect. Both sides, yeah, very good, very good, very good. Now, can you tell me when my fingers enter your vision? Perfect. Good. Good. Brilliant, brilliant. Okay, okay, okay. Now can you tell me when my fingers leave your vision? Good. 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 Perfect, 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 perfect. Okay, so now I'm gonna test your color vision. I want you to tell me what color is this? Yeah, it's blue. What color is this? Yes, it's yellow. What color is this? Yes, it's green. And what color is this? Yes, it's red. Very good, very good, very good. Now, I want you to follow the green pencil and ignore the red pencil, okay? Now switch. Okay, very good. So you don't have any trouble with your color vision. Seems very good. So now I'm going to be examining your ears. I'm just going to come a bit close and have a look at this side of your ear. This ear looks very good. A bit of buildup of wax. Yeah, and on the other side, you have some earwax here as well, but it's not really that bad. Okay, I think I'm gonna clean out your ears with some Q-tips. Just to get the wax out, okay? So I'm gonna start on this side. Very good. Now on the other side. Okay, good. So now that your ears are all clean, I want to test your hearing, okay? So I want you to close your eyes, and tell me what side you hear my fingers snap on, okay? Close your eyes, close your eyes. Good. 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 Perfect, 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 perfect. So now I'm gonna be whispering some words into each ear, and I want you to repeat them back to me, okay? Lollipop, lollipop, lollipop. Good, good, good. Christmas, 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 Christmas. Good. Examination, examination, examination. Examination, good. An animal, good, 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 good. So now I'm just going to be taking a quick peek up into your nose. So can you tilt your head slightly backwards? So I'm just going to look into your nose. Okay, it looks good. Now I want to look into your throat. So can you say ah for me? Thank you. Both your nose and your throat looks okay. There's no soreness, no redness. Okay, now I'm going to be testing your reflexes. I'm going to be using this hammer, but I'm going to be very gentle, okay? I just want you to relax your arms, and I'm going to be tapping on your elbows, okay? Relax your arms. Good. Okay, other side. Very good. Now relax your legs because I'm going to be tapping on your knees. Good. Other side. Very good, very good, very good. Very good, very good, very good. Now can you push up your shoulders like this, and I'm going to try to push them down, but you will resist, okay? Very, very good. Now, can you frown like this? Good. Can you raise your eyebrows? Good. Can you keep your eyes shut, and I will try to open them and you will resist? Perfect. Very good. And now can you keep your eyes open, and I will try to close them, but you will try to resist? Very, very good, very good, very good, very good. Now we are almost done, I'm just going to test your sense of touch. So I want you to close your eyes, and tell me if you can feel a soft or a rough brush touching your face, okay? Close your eyes, close your eyes, close your eyes. Soft or rough? Good. 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 Soft or rough? Perfect, 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 perfect. Okay, so we are done with the exam, and you did mostly perfect. Yeah, you seem to be in perfect shape. I'm just writing down the conclusion. The only thing that I'm a bit worried about is the wound on your forehead, and I think it's very important that you get it checked out with an MRI, okay? But other than that, you are good to go. I'm just writing down the results. Okay. Thank you so much for coming in, and I will see you next time. Okay, goodbye. Hello and welcome into the doctor's office. So my name is Dr. Cami. Please take a seat. Perfect. So can I get your first and last name, please? Perfect, thank you. And can you confirm your date of birth for me? Perfect. That's right. Have you changed your phone number, or is it still the same? Still the same? Have you moved recently? Have you changed your address? No. Okay, good. And can you tell me what brings you in today? Okay, so you want a comprehensive medical exam? Okay, yeah, I can do that. It's been a while since your last exam, so it's probably due. Okay. Have you noticed any symptoms? Anything that's bothering you at all? Okay. So you think you just have a cold? Yeah. We can check that out. Okay. So the first thing that I'm gonna do is I'm just going to be taking your temperature with this, and this measures your forehead temperature, okay? So I'm just going to okay, let's see. There it is. Okay, so your temperature is a bit elevated, but not quite a fever. Do you know where you normally lie in the range? Okay, so I wouldn't worry too much about that. It could be your cold, as you say. So I think I'm going to start by just taking your vital signs, okay? First, your blood pressure. So I'm going to place this cuff around one of your arms. So if you can please reach out an arm for me. Thank you. So I'm just going to be placing this right there. Then we're going to start, and now you have to stay calm and relaxed. Calm and relaxed, okay? Okay, perfect. I'm going to remove the cuff. Okay. That's good. So your blood pressure is quite normal, yes, so you don't have to worry about that. I noticed your heart rate was a bit elevated, so I'm going to take a listen to your heart. Just breathe normally for me. Okay, yeah, so it is a bit fast. It could be because you have an infection in your body that can increase your heart rate, okay? Would you mind turning around so that I could listen to your lungs? Thank you. I'm just going to pull up your shirt slightly if that's okay, thank you. And now take deep breaths for me, in through your nose and out through your mouth. So your lungs are sounding very good. I'm going to take a note of what I have done so far. Okay. I also want to see if you have enough oxygen in your blood, so I'm going to be using this little thing. Okay, I'm going to place it on your finger. I'm going to check your saturation levels and your pulse. Okay, it all works out well. I don't have any worries about that, so that's good. Now I would like to do just a quick face exam of you. Okay, just a quick face exam. So I'm going to put on some gloves. And obviously I need some hand sanitizer, so yeah. It's just because I'm going to be touching your face. Yeah, is that okay? Good. So I'm going to feel your nose. Okay. And your forehead, just then gentle taps. Okay. And down the sides of your face. Okay, and I'm going to check your lymph nodes. So I'm just gonna see here. Okay, seems normal. I can tell that your face is a bit puffy. Your cheeks are a bit puffy. And your eyes may be a bit swollen. Can you please just open up your eyes for me? Okay, good. Can you close your eyes? Close your eyes. Okay, good. So you probably do have a cold, but I'm going to look with my light. I'm just going to check your nose real quick, so if you can tilt your head slightly backwards. Thank you. Just going to look into your nose. Okay. Yeah. You're a bit congested. But that's very normal, especially around this part of the year. So don't worry too much about that. I can prescribe you just some nasal spray to help you with that. And you can use over-the-counter pain medication if you feel like your sinuses are a bit painful. Yeah, I can touch. Do you feel any pain? Not really? Okay, well then I strongly I believe that it's just a common cold, okay? But come back if it gets any worse. Yeah, promise me. Good, 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 good. Okay. So I'm going to take some more notes. Okay. Perfect. Last time you were here, I think I remember that we measured your face, so that should be in the database. I just want to make take some measurements right now, just so that we can compare. Okay. So I have this measuring tape, and I'm just going to take some slight measurements of your face. Okay, yeah. Yeah. Okay. 4, 5, 6. Okay, yeah. 21, 22. 3.5. 4, 5, 6. 12, 13. 11. Sorry, 11, 12. Okay. So I'm going to add that into the database. Okay. Just to be sure. Okay. Now I'm going to look into your eyes. So I want you to just look at my nose, okay? Yeah, just look at my nose and don't look at the light because it can be a bit uncomfortable, okay? So I'm just going to look. Look. Okay. Look. Okay. Okay, so your eyes, your pupil seems to be dilating and contracting very well. Now I want you to look at the weaker light, which is this one. This is the stronger light, and I want you to follow just the weak light, okay? When I say switch, I want you to switch to the stronger light, okay? Switch. Okay, very good. I want you to look at my nose again, and I want you to tell me which side is moving. Yeah, what fingers. Okay? Good. Now close your eyes. No, don't close your eyes. I'm sorry. Look at my nose, okay? Good. Good. Perfect. Perfect. Yes. Good. Very, very good. Very good. Very good. Okay. So your eyes, they seem to be in very, very good shape. Yes, they seem to be in very good shape, okay? And they are very pretty. Yes, you have gorgeous eyes, okay? I want to look into your ears. So can you tilt your head that way for me? Thank you. I'm just going to look, have a quick look. Just a quick look, okay? Okay, can you look that way for me? Thank you. Just having a quick look, quick look into your ear, okay? Yes. So your ears seem to be fine. Where did I put my pen? Okay, there it is. Okay. Now I'm going to be testing your reflexes. So I have this hammer. And I'm just going to do small taps on your elbows and on your knees. So it's very important right now that you relax your body, okay? Yeah, don't be tense at all, just relax. Relax your body, okay? Good. Now I'm going to test your arms first. Good. Good. And now your knees, okay? Good. Very, very good. So your reflexes, they are working perfectly. Okay, so now I'm going to be testing your sense of smell. I first have, now you have to close your eyes. Yeah, close your eyes. And I want you to smell this. Just smell it, okay? What does it smell like? Nail polish, yes, that's correct. Another one. Close your eyes, close your eyes. Close your eyes, okay. Okay. What does this smell like? What does it smell like? Yes, it's coffee. Very good. So even if you're congested, you can still smell coffee, which is great. Okay. And now I want you to do a quick taste test for me. Put this in your mouth. Okay, what does it taste like? Strawberry, good. Put this in your mouth. What does it taste like? Banana, good. And now put this into your mouth. What does it taste like? Apple. Very, very good. I'm going to take one. Do you have your shots? Your flu shots? Or any other shots you have to get done? Okay, you want to get your flu shot done? No problem, I can do that. I have it ready here for you, so I'm just going to extract and I'm going to place it in your arm. And I'm going to extract another one and place it in your other arm. Okay. Good. Okay. I think you're pretty much done. Let's see. Okay, yeah. So you did very well. I have no concerns, okay? but I want you to come back if the cold doesn't go away within a week or so, or if you get any other symptoms that are worrying you, okay? Perfect. Very good. But for now, I wish you a very good day or a good night wherever you are in the world. And I will see you later. Okay. Goodbye. Hello. Welcome in. So, I'm Dr. Cami. Nice to meet you. So you were referred here for a cranial nerve exam. So I'm the one who's going to be performing that on you today. First, I want to just confirm some of your details. So can you please confirm your first and last name for me? Okay. Perfect. And your date of birth? Yes, that's correct. And that's really all I need. I've got all your other details here. So let's just start. I'm going to start by putting on some gloves. And since I am a doctor, even though it's a cranial nerve exam, I'm going to be checking your vitals. Okay? We just want to be safe so that we are sure that we are not missing anything. Okay, so the first thing that I'm going to do is that I'm going to be taking your temperature. So if you can open your mouth for me, I'm going to place this under your tongue and close your mouth. Okay, perfect. So you don't have a fever. That's very good. That's very, very good. I'm now going to be taking your blood pressure. So I'm going to be adding this cuff to your arm. If you can reach out an arm for me. Thank you. I'm going to be placing it there. And now it's very important that you relax, okay? Relax. Okay. So let's remove your cuff. And yeah, your blood pressure looks very, very, very good. That's perfect. I'm also going to be checking your oxygen levels. So I'm gonna need you to reach out a finger for me. Thank you. And I'm gonna be placing this little thing on your finger. And I'm just going to be checking. Okay, 99%. That's very, very good. You have 99% of oxygen in your blood, which is perfect. Okay. And now I'm going to listen to your heart and your lungs. So I'm going to be putting on these. And I'm first going to be listening to your heart, okay? So just breathe normally for me. Thank you. Perfect. Now can you turn around for me, because I want to listen to your lungs as well. Thank you. And I'm gonna pull up your shirt slightly And now I want you to take deep breaths for me, okay? In through your nose and out through your mouth. Very good. So both your heart and your lungs sound as they should. Your heart is beating normally and your lungs are sounding perfect. Okay, so now, with your vitals all done, we are going to start with the cranial nerve exam, but I always like to start with just feeling your face a bit, if that's okay. Yeah, just to check your bone structure and check for wounds and bumps and anything like that, okay? So I'm gonna get a bit close, is that okay? Thank you. And I'm just gonna be feeling your face very gently, checking for any irregularities, okay? Okay, feels normal down your nose and your cheeks and your forehead. Can you bend your head slightly forward so that I can check your scalp? Yeah, your scalp. Thank you. So I'm just gonna be inspecting your scalp. Okay, everything looks normal. Now I would like you to tilt your head slightly backwards and I'm going to check your lymph nodes, okay? Thank you. Okay. So that seems good. And now I'm going to be tapping on each side of your face very gently. Just let me know if it feels equal, if it feels the same on each side of your face, okay? So I'm gonna start on this side and I'm just gonna okay, and now on the other side. You're not sure? Okay, I'll try one more time. And now on the other side. Okay. It seems equal. Okay, very good. Very, very good. Yes. So I'm also going to have to ask you to raise your eyebrows, like so. Perfect. And frown. Good. Now puff out your cheeks. Very good. And can you smile for me? Perfect. Very good. You're doing amazing. I'm also going to feel each of your arm. I'm just gonna tap tap lightly on your arms, and I want you to let me know if it feels the same on each side, okay? Yeah, so I'm gonna... And on the other side. Does that feel the same? It feels the same. Okay, perfect. Perfect, perfect, perfect. Now I'm gonna be removing my gloves. Okay. And I'm going to be checking your eyes. So the first thing that I'm gonna check is for pupil dilation and contraction. Pupil dilation and contraction. Dilation, dilation and contraction, okay? So I want you to just look at my nose. No, don't look at my nose. Look at the wall behind me, okay? Or anywhere really, but don't look at the light, okay? And I'm just gonna first check this side. Okay. Okay, very good. And I'm gonna check the other eye. Okay, very good. Now I'm gonna come from up here. Okay, and now from down here. Okay, perfect. So your eyes, they seem to be responding normally to light, which is what we want, obviously. Okay, so now I would like you to follow my finger, okay, using only your eyes. Don't move your head, use only your eyes to follow my finger, okay? Perfect, 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 perfect. And now I want you to look at my nose. This time, actually, look at my nose, look at my nose, look at my nose, okay? And let me know how many numbers I'm holding up, okay? Good. Good. Very good. Very good. Perfect. And now on the other side. Look at my nose, look at my nose. Good. 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 Very good, very good, very good. Now close your eyes, close your eyes, close your eyes, close your eyes, close your eyes. And I want you to touch your nose with one finger at a time, okay? Yeah, you can open your eyes and I can show you, okay? So like this. Okay? Can you do that? Yeah, close your eyes. Okay. Okay, 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 okay. Okay, okay, okay. Very good, very good. Perfect. You're doing very, very good so far. Everything is as expected, as expected. Now for a letter chart, I want you to read these letters for me, okay? Starting up here. Good. Good. Very, very good. Yes. 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 Good. Perfect. That's a bit more difficult, yeah? Good. It's a wacky J. Yeah, very wacky. Okay. Good. Good. Very, very good. Perfect. Good. Amazing. Amazing, 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 amazing. Okay. So I'm just going to be taking a note of that. Okay. And now for your ears, I'm just going to be quickly looking into your ears, okay? So first on this side. Okay. Everything looks normal. Your ear is very clean. Now on this side. Okay, your ear looks very clean on this side as well. Yeah, okay. Okay, so both ears are very clean, okay? Now I'm gonna be whispering some words into your ear and I would like you to repeat them back to me, okay? Perfect. Television. Television, television, television. Television, good. Highlighter. Highlighter. Highlighter, very, very good. And one final word. Flower. Flower, yes, it's flower. Very good. And now I want you to close your eyes again. Close your eyes and let me know when you can hear the sound of a flame, okay? A flame, yes, with a lighter, okay? Perfect. Perfect. So your hearing is also very good. Everything seems to be going very, very well so far. Okay, so now I'm gonna peek into your nose, okay, with this light. I'm just gonna have a little peek, okay, if you can bend slightly backwards. Thank you. Okay, looks good. Now I want you to do a smell test for me, okay? So I have 3 different spray bottles with 3 different scents, okay? And I'm gonna spray it on a Q-tip and you let me know what scent it is, okay? So the first spray and the first scent. Okay, smell it, smell it, smell it, smell it, smell it. You are correct, it is mint. It's mint, 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 mint. It's mint, okay? Okay. And for the next scent, I'm taking a fresh Q-tip and a new spray bottle. And I'm gonna spray. Okay. Now smell it, smell it, smell it. Very, very good. It is indeed coffee. And now for the final scent, I'm taking a fresh Q-tip and I'm gonna spray the scent on the Q-tip. Okay, and I want you to smell it, smell it, smell, smell, smell. Yes, it is citrus, citrus, citrus. Perfect. Very, very good. I'm gonna write that down. You did 3 out of 3. Okay, and now for your taste, your sense of taste, I would first actually like to look into your throat, okay, with this light. So say R for me. Thank you. I'm just gonna be looking into your throat. Okay, everything looks normal. It looks normal. No abnormalities at all. No abnormalities, okay. Okay, very good. Can you swallow for me? Yeah, I'm just gonna feel when you swallow. Okay, perfect. Perfect. And now I want you to taste these different Mentos. I don't know. Okay, so I'm gonna open the package and I want you to close your eyes and reach out your hand to me, okay? So we have 3 different flavors, okay? I'm gonna give you this. Okay, take it, put it into your mouth and taste it. Chew it, chew it. What does it taste like? Yes, it's strawberry, it's strawberry. It's strawberry, strawberry, strawberry. Okay, very good. Now, reach out your hand to me again. I'm gonna place this in your hand. Put it in your mouth and chew it. Chew it. Yes, it's lemon. It's lemon. And for the final one, I'm gonna give you this, okay? I'll place it in your mouth. Chew it, chew it. What does it taste like? Yes, it's orange. It's orange. Okay. Okay. So you have done pretty much excellent. Just one final test. I would like you to raise your shoulders like this, and I will try to press them down, okay? And you will try to resist, okay? Very, very good. And now move your head to that side, okay? And I'm gonna attempt to push it back, but you will attempt to resist, okay? Very good. Now that side. Turn your head that side. And I will try to push your head back to the front. Okay, very good. Very, very good. You're doing amazing. And I must say, I think that's all for today, okay? So I'm just going to be writing down the results, which were marvelous. And I'm gonna be sending this report back to your doctor who referred you to me, okay? Okay, so thank you so much for coming in. Thank you for coming in, and I hope everything goes well for you, and I wish you everything good, okay? Now have a wonderful day or a good night wherever you are in the world, okay? Okay, goodbye. Hello to you. I am Dr. Tammy. Nice to meet you. And I will be performing a cranial nerve exam on you today, if that's okay with you. Is that okay? Perfect. So first, I'm just gonna have to take some information from you. Okay, first thing I'm going to do is that I'm going to shine a light in your eyes to check your pupils, and I want you to look at the wall behind me. Okay. It's a bit bright, I'm sorry. Okay, good. Now can you follow my finger? Very good. Very good. Okay. Now I want to test if you can read these letters. What is this letter? Good. What is this letter? Good. What is this letter? Very good. Okay. Now I want you to tell me whether the light is becoming colder or warmer. Okay? Colder or warmer? Good. Colder or warmer? Good, very good. Okay, you did very well. So, I'm going to test your sense of smell. So I have this Q-tip, and I'm just going to spray a solution on it, and you let me know what it smells like. What does it smell like? Citrus, yes, very good. And I have another Q-tip, and I want you to let me know what this smells like. Strawberry, yes. You're doing so well. Now all is left to subject your sense of taste. Your taste. Okay, so I have this. If I can open it. Take a sip. What does it taste like? Yes, it's vanilla. You're doing so good. Okay. And next, I have this. Take a sip. What does it taste like? Yes, chocolate. Very good. And now I have this last one. What does this taste like? Caramel. Yes, it's caramel. You did amazing. Amazing. So I'm now just going to take a note of the results. Yes, it's important to have a yearly checkup. Yes. You're free to go. I'm just going to. Yeah, there we go. Okay, I see you now here. Now have a wonderful day or night. I hope you feel relaxed wherever you are in the world. Okay, goodbye. Hello, welcome in. So what brings you in today? Okay. I see you've been feeling a bit under the weather. Yeah. And how long has that been going on for? Okay. Have you found anything that helps relieve your symptoms? No? Okay. I see that you have a scrape on your face. How did that happen? Okay. I see. You fell and hit your head. Oh, poor thing. We will definitely be taking a look at that. I'm gonna clean it up for you. And I think we will definitely be doing a cranial nerve exam in addition to the checkup. Okay? First, I just need to ask you a couple of questions. Do you have any pre-existing medical conditions that I should be aware of? Okay. Do you have any family history of, say, diabetes, high blood pressure, cancer, anything like that? Okay. That's very good for me to know. Do you take any medications? Okay. And I guess that's for the, yeah. Right. Do you have any allergies? Seasonal allergies? Okay, any allergies to medications? No? Okay. Just seasonal allergies. Okay. And finally, do you know your height and your weight? Okay. Okay, very, very good. So now that we have all of that information, I think the first thing I'm gonna do, well, the very first thing that I'm gonna do is be putting on some gloves. And I want to have a look at that scrape, yeah, that wound on your face. Okay, does it hurt? Just a little bit, it stings a little bit. Yeah, it's not very big, I don't think you need any stitches. Okay, I'm just gonna clean it up for you. Yeah, I'm gonna be using some cotton. Like so. I'm gonna be using this alcohol. Okay. just sit still for me while I just clean it. Does this sting when I clean it? A little bit. Yeah, I'm sorry. It's going to be over very soon. Okay, perfect. I'm just going to give you a plaster. Just to cover it up and make sure that you don't get any dirt in there, because you don't want to get the wound infected. If I can open this. There we go. Okay. Okay, so I'm just going to place it right there. Okay. Perfect. Okay. Now I would like to, if it's okay with you, well, I'm going to do it anyways, just to make sure you don't have a concussion or like a brain bleed. I highly doubt it, but we want to be on the safe side. So I'm just going to be using this scanner. Yeah, it's new tech. Okay. Very good. And I'm going to load that into the system. Just check here. Okay, so someone will definitely be evaluating that. I'm not a radiologist, so unfortunately I'm not qualified to review that scan, but I'm sure we will have it by the end of the exam. Okay, so now I want to just be taking your vitals. I'm gonna start by taking your temperature, so just sit still. Okay, so you don't have a fever. That's always a good sign. I'm going to be listening to your heart and your lungs. Okay, so just breathe normally for me. Okay. Okay, that sounds fine. I'm now going to reach behind to your back and listen to your lungs. And now I want you to take deep breaths in and out for me, okay? Deep breath in and out. Deep breath in and out. Perfect. So your heart and your lungs are both in good health. I'm gonna be measuring your blood pressure. So I'm just gonna be placing this on your wrist, right so, and I'm gonna be pumping. (120/80), so that's perfect. That's like pitch perfect, actually. Okay. And just to be sure, I'm going to also be measuring the oxygen levels in your blood. So if you can please reach out a finger for me. Thank you. Place this there. Okay. 98%. That's perfect. That's perfect. Okay, and now I would like to feel your lymph nodes. So if you can tilt your head slightly back for me, just gonna be feeling around your neck, behind your ears, and on your collarbone, okay? Yeah. Very good. You don't have any enlarged lymph nodes. If you did have that, I would say you probably would have been experiencing an infection, but I don't think that's the problem here. Okay, so let's see if the result of the scan is ready. And everything looks good. Yeah, your brain looks very healthy, no damage. Okay, so it's just a wound and it will heal very soon, I'm sure. Okay, so now I'm going to be testing your reflexes on your elbows and on your knees. Just gentle taps, really. So just relax your body. Relax. Perfect. Good. Other side. Good. And your knees. Good. Very good. So your body is responding the way it should to those taps, which is just amazing. I want to be looking into your ears, your nose, and your throat. I'm gonna start by looking into your mouth. Can you open up for me and say, ah, thank you? I'm just gonna be looking. Okay. Can't see any issues. Looks pretty normal. No redness. No plaque. Okay, looks good. Okay. I'm going to be looking up your nose. Okay. Other nostril. You're a bit congested. Have you been experiencing a runny nose or anything like that? Yes, you have? Okay. Interesting. It didn't look too bad at all, but it's annoying to have congestion and a runny nose, so we will see what we can do about that, okay? I'm going to be looking into your ears. First on this side. Just looking. Okay. A bit of earwax, but that's normal. Nothing too bad at all. Okay, other side. Okay, this ear has a little bit more earwax, but still not a massive build-up. Can't see any swelling or redness. Looks pretty much normal. Yeah, okay. Okay, So now for your eyes. I'm first gonna check if your eyes respond to light the way they are supposed to. Yeah, your pupils are supposed to dilate and contract. So let's see if they do so. Just gonna place this hand in the middle of your face. Okay, good. Now other side. Okay, very good. That all appears to be working well. I would like to give you some eye drops. They are going to dilate your pupils so that I can have a better look at your retina, okay? Yeah. So I'm just gonna drop into each eye. Good. Let's give that a few seconds to work. Yeah, your vision might get a bit blurry for a few minutes, but that's completely normal, okay? Okay. Now, I'm gonna be looking into your eyes again. And now I want you to look up for me. Look up, look up, look up. Look up, look up, look up, look up, look up. Okay, now look down. Look down, look down, look down. Look down, look down, look down, look down. Look to the side. Look to the side, look to the side. Okay, look to the other side. Okay, good. Very good. I can't see anything wrong with your retina or your eyes in general. There's no redness. The whites of your eyes seem very healthy. So that's all good stuff. Now I want to be testing. It's kind of like a color/mind coordination thing. So I have this clock with numbers, and I want you to tell me the color and the number that I'm pointing to. Okay, so let's start with this. Blue and 2, good. What about this? Perfect. What about this? Good. And this color and number? Green and 12. Perfect. Very good. Okay, I also want to test your peripheral vision. So if you can look at my nose and just tell me which side my fingers are wiggling on, okay? Good. Good. Yes. Yes. Good. Yes. Perfect. And now I want you to keep looking at my nose and tell me when my fingers enter your field of vision, okay? Good. 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 Very good. Now tell me when my fingers leave your field of vision, okay? Good. Yes. 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 Perfect. Perfect. You're doing so well. You're doing so well. Now, let's check out your hearing, shall we? So, the first thing I'm going to do is I'm going to be using these scissors to make a sound on either side of you. And I want you to close your eyes and tell me which side you hear the scissors on, okay? Okay, good. Close your eyes, close your eyes, close your eyes. Good. Yes. Good. Good. Yes. Good. Perfect. Perfect, perfect. And now I will be whispering some numbers into each of your ears and just repeat them back to me. Yeah, very simple. Okay. 193. Good. 625. Good. 962. Good. 186. Perfect, perfect, perfect. Okay. Now to check your facial nerves a bit, can you make some facial expressions for me? Yeah, just start by raising your eyebrows. Very good. Okay, now can you furrow your eyebrows? Good. Can you puff out your cheeks? Very good. Can you give me a big smile? Perfect. And can you frown? Very good. Okay, so that's all good. Now I'm going to be using this roller to touch your face, and I want you to close your eyes and tell me when you can feel this roller touching your face, okay? Okay, close your eyes, close your eyes, close your eyes. Yes. Yes. Good. Very good. And now for a soft or sharp test. I want you to tell me if the soft side or the sharp side is touching your face. Okay? Close your eyes again. Close your eyes again. Okay. Yes. Good. 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 Yes. 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 Very good. Very good. So you're doing very well on all of these tests, which makes me think that there's nothing wrong with your cranial nerves. But I'm also going to be testing the sensation on your body. So I'm going to be stroking on each arm, and I want you to tell me if it feels equal on both sides, okay? Okay, good. I'm going to start on this arm. Okay, and now on the other arm. Okay, did that feel equal? You think so? Okay, good. Now for a little smell test. I'm actually going to be removing my gloves because I don't need them anymore. So it's important to test your sense of smell, because that's also a part of the cranial nerve exam. So I'm going to be taking a Q-tip. I'm going to be spraying a scent onto the Q-tip, and you let me know what it smells like, okay? Smell it, smell it, smell it. What does it smell like? Yes, it's coffee. Okay, now for another scent. Okay. Smell it, smell it. Yes, it's citrus. citrus. Very good. And for the final one, okay, smell, 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 smell it. Smell it, smell it, smell it. What does that smell like to you? Mint. Yes, it is mint. Perfect. So that leaves the taste test. So I'm going to be giving you a liquid that I want you to take a sip of and tell me what it tastes like. Okay, starting with this. Take a sip, take a sip, take a sip, sip, sip. What does that taste like to you? Vanilla? Yeah, that's correct. That is correct. And a second one. Taste it. Take a sip, taste it. What does that smell like? Chocolate. Yes, very good. Very, very good. Okay, so I'm gonna be taking some notes because we are done with the exam for now. You mentioned to me that you have seasonal allergies. Do you use anything for that? Any eye drops, pills, anything? No? Okay. Because I think that could be why you have the runny nose, because it's allergy season right now, and it can also make you feel very tired and you were feeling under the weather. Yeah, allergies can do that to you. So what I'm going to do, if it's okay with you, is give you an allergy shot. It's like a vaccine. It will basically get rid of your allergies for you. Okay. So let's see, I have it right here. Which shoulder would you prefer me to place the shot? This shoulder. Okay. I'm gonna be very gentle. Are you afraid of needles? A little bit. Okay, it's gonna be very quick and painless. Okay, just gonna feel a little pinch. Okay. Okay. Perfect. You did so well. Yeah, that wasn't a problem, was it? No? You're very brave. Yeah. And I would also like to give you some medicine. These are allergy medications, some tablets that you can take every morning and every night to relieve your symptoms. Yeah. Okay. There you go. Okay, so that concludes your doctor's visit for today. You seem to be in good shape. You're just a bit, I don't know, lethargic maybe, but I'm sure it will resolve. If it doesn't resolve with the things I've given you, then come back. Yeah, please come back then, and we will see what we can do. Okay. Thank you so much for coming in, and enjoy your summer. Okay, goodbye. Goodbye, 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 goodbye. Hello and welcome to the doctor's office. So I'm Dr. Cami and I'm going to be your doctor for today. Now can I get some information from you? Perfect. So what is your first and last name? Okay, what is your date of birth? What is your home address? And the zip code for that is, okay, yeah. Do you know your blood type? Okay. What's your gender? Okay. And do you have an emergency contact? Mm-hmm. Yeah, both the first and the last name. Okay. And what relation does this person have to you? Okay. So today I'm going to be performing a thorough checkup on you, including a cranial nerve exam. It's going to be quite simple for you. All you have to do is sit back and relax and follow my instructions, okay? Good. Okay, so I'm going to start by taking your vitals. So I'm going to be listening to your heart and your lungs. Okay, now it's very important that you just breathe normally and try to relax. Okay, now can you turn around so that I can listen to your lungs? Thank you. Now take a deep breath in through your nose and out through your mouth. Again. One more time. Perfect. So you can turn straight forward again. Both your heart and your lungs are sounding very healthy, very normal, like just as they should, okay? So that's a good beginning. Now I'm going to be taking your temperature. So this is going to measure the temperature on your forehead. Okay, now let's see. Okay, very good. So you don't have a fever. That's always a good sign. Now I'm going to be measuring your blood pressure. So I'm just going to be adding this cuff around one of your arms. Like so. And sit back and relax for me. Relax, relax, relax. Okay. Okay. So your blood pressure is normal, which is what we always wish for. Now I'm going to be I'm going to be measuring your pulse and also the oxygen levels in your blood. Okay. So can you reach out a finger for me? Thank you. And I'm going to place it right there. Okay, let's see. Okay. Very good. So your pulse is a bit high, but that's normal. When people go to the doctors, they always have a bit of a higher heart rate. And your saturation levels are 99%, which is perfect. Okay. Good. So I'm just going to be taking some notes. Good. And now I'm going to examine your face. So I'm going to be putting on some gloves. And I'm gonna be sterilizing my gloves. Okay. Okay. Is it okay if I touch your face? Okay, thank you. I'm just gonna be checking your forehead. I'm looking for any lumps or bumps, any wounds, any cuts or bruises, any acne, anything like that. Your cheeks and your jawline, your nose. Can you tilt your head slightly forward so that I can check your scalp? Perfect, thank you. Okay, so it looks pretty normal. Your scalp is just a bit dry, so you can try using an anti-dandruff shampoo, maybe. Just a suggestion, okay? And now can you tilt your head slightly backwards so that I can feel your lymph nodes? Thank you. And on your collarbone. Good. Okay, now I want you to do some facial expressions for me. So can you raise your eyebrows? Good. Can you frown? Perfect. Can you puff out your cheeks? Good. I'm just going to feel that. Okay. Now can you smile for me? Good. So I'm going to be testing your facial sensation by using this brush. I want you to close your eyes and tell me whether you can feel the soft side of the brush touching your face or the sharper side of the brush touching your face. Okay, now let's start. Close your eyes. Good. Yes. Good. Very good. Okay. Perfect. I'm also going to be using this roller. I want you to close your eyes and tell me when you can feel it, okay? Good. Yes. Okay, good. Now you can open your eyes. I'm going to be rolling this on each side of your face, and I want you to tell me whether it's equal or not on both sides, okay? So I'm going to start on this side and this side. Is that equal? Okay, good. Another one, this side and this side. Is that equal? Okay, very good. Very good. So now I'm going to be testing your vision. I'm first just going to be looking at your eyes with my light. First I'm going to be checking for pupil dilation and contraction. Okay. Good. Now can you look up for me? Look up. Thank you. Now look down. Look to that side. Good. Now look to the other side. Good. Perfect. Okay, now follow the light with your eyes. Don't move your head. Use only your eyes. Good. Okay, now look at my nose. Look at my nose. And let me know when my fingers leave your field of vision. Good. Good. Perfect. And good. And now keep looking at my nose and let me know which side is moving. Good. Yes. Yes. Good. Good. Perfect. Good. Yeah, both. That was both. That was both. Okay. Now I want you to touch your finger to your nose tip while you have your eyes closed, so like this. Okay, can you do that? Thank you. Good. And now with the other finger on your other side. Good. Good. Okay. Very, very good. So now I have this eye chart and I want you to tell me whether the E's are the right or the wrong way, okay? So is this E the right or the wrong way? Good. What about this E? Is this the right or wrong way? Good. Is this the right or wrong way? Good. What about this? Perfect. This? Okay, and is this the right or wrong way? Okay, very good. Now I want you to tell me what colors you see. What color is this? It's yellow, yes. What about this? Green, good. This? Orange, yeah. This? Purple. Okay, very good, very good, very good. So your vision and your eyes seems to be working perfectly. Now I'm going to be looking into your nose with this. Okay, so just tilt your head backwards. I'm going to be looking. Okay, looks okay. The airflow is good. Other side. Okay, the same here. No swelling, no redness. Okay, yes, it looks very good. Perfect. Now I'm going to be looking into each ear and just see if your ears are healthy. Okay, so I'm starting on this side. Okay, it looks good. Just a little bit of earwax, but that's supposed to be there, so no problem. I can't see anything wrong. Okay, other side. Okay, the same here. Just a little bit of earwax. Yeah, otherwise it looks very healthy. Very, very healthy. Okay, good. So now I'm going to be looking into your mouth and your throat. So open up and say ah to me. Thank you. Okay. It looks good. You have a bit of a red throat, but nothing that I'm worried about. Okay, I can see that you take good care of your teeth, which is very important. Okay. Good. So now I'm going to be checking your reflexes. So I want you to just relax your body and don't be tense at all. It's very important that you relax. And I'm going to be tapping with this on your elbows and your knees, okay? So first elbows. Good. Other side. Good. And now the knees. Good. Other side. Very, very good. Can you shrug your shoulders for me? And I'm going to try to press them down and you will resist. Okay, perfect. Resist, 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 resist. Very good, very good, very good. Okay, so now I'm just gonna be feeling your abdomen. So I'm gonna lift up your shirt slightly, and I'm just gonna be palpating your abdomen. Let me know if anything feels uncomfortable or painful. Any pain at all? No pain? Okay, good, 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 good. I saw in your record that you haven't gotten your flu shot. Is that something you want to do now? Yes, okay. Good, because I have it ready right here. I'm just gonna be extracting the vaccine into this. And I'm gonna be injecting it into your shoulder. So 3, 2, 1. Good. Very, very good. So now I'm gonna be testing your sense of smell. So I have these Q-tips. And I'm going to take a Q-tip and I'm gonna spray it with some scented liquid. Okay, what does it smell like? Smell it, smell, 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 smell. Yes, correct, it's mint. It's mint, very good, very good. And now what does it smell like? Smell it, smell it, smell it, smell. Yes, correct, it's coffee. It's coffee. And the final one. Okay, what does it smell like? What does it smell like? Yes, it's citrus. It's citrus. Perfect. Because you have a little bit of earwax in your ears, I'm just gonna test your hearing to see if it affects your hearing at all. So, I am going to whisper some numbers into each ear, and I want you to repeat them back to me, okay? Okay, good. 3, 4, 7. 3, 4, 7, good. 1, 9, 7. 197, yes. 3, 1, 5. 3, 1, 5, good. 4, 6, 2. 4, 6, 2, perfect. Perfect, perfect. I also have these scissors. And I want you to close your eyes. Close your eyes and tell me what side you can hear the scissors on. Okay? Good. Good. Yes. Good. Perfect. Good. Yes. Awesome. Awesome, awesome. So your hearing is also fine. Just gonna be noting some things down. Okay. And now for the final test, we are going to test your sense of smell. So I have some flavors that I'm going to give you right now. So take a sip of this. Okay. What does it taste like? Yes, correct. It's chocolate. It's chocolate, chocolate, chocolate. Okay. Another one. Take a sip, take a sip, take a sip, take a sip. Okay. What does it taste like? Yes, it's vanilla, vanilla, vanilla. You're doing so good. Okay, and the last one. Okay. Take a sip, take a sip, 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 take a sip. Okay. So what does that taste like? Yes, you are correct. It is salty caramel. Salty caramel, okay. Good, 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 good. Okay, so I think we are done here. You did amazing on all of the tests. You passed with flying colors. I'm gonna schedule you for an appointment in half a year, just as a follow-up, okay? Yeah. And if you feel anything strange in the meantime, or if you feel unwell in any way or form, then please come back in and I will help you as best as I can, okay? Good, good, good. Okay, so now have a wonderful day or a good night wherever you are in the world, okay? Okay, goodbye, 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 goodbye. Hello, hello. So I'm gonna be examining you today. My name is Dr. Cami, as you can see right here. Okay, first I'm just gonna have to take some information from you. So what is your first and last name? Okay, what is your gender? And your date of birth? Do you know your blood type? Okay. Did you take a blood test before coming here? You did? Okay, I'm gonna check the results later. Yes, do you know your height? Do you know your weight? Okay, and why did you come in here today? Just for a checkup? Okay. And you want your flu shot? Okay. Perfect. So I'm gonna start by just listening to your heart, if that's okay. Okay, now just breathe normally for me. Perfect. Can you turn around so that I can listen to your lungs? Thank you. Now take a deep breath in through your nose and out through your mouth. In through your nose and out through your mouth. Again. Very good. So your heart and your lungs sound perfectly normal. I'm going to be taking your blood pressure. So I'm just going to I'm going to put this cuff around your wrist. And I'm going to pump. Okay, now let's check the result. Okay, so your blood pressure is very good. It's 120/80, so it's just perfect, okay? Now I'm going to be taking your temperature, so open your mouth for me, lift up your tongue, and I'm going to place this. I'm going to place this under your tongue. Close your mouth. Okay, perfect. So you have a temperature of 37 degrees Celsius, and that's perfect. It's just the way it's supposed to be. So no worries there. And now I'm gonna be looking into your ears with this, okay? So I'm just gonna start on this side. Okay. Looks healthy, no redness, no swelling, just a little bit of earwax. Okay, other side. Okay, Yeah, this ear is the same. Just a little bit of earwax, but nothing too bad. Is your hearing okay? Do you hear sounds? Okay, good. Good. I'm gonna take a peek up your nose, so can you tilt your head slightly backwards? Thank you. I'm just gonna look. Okay, the other side. Look up, look. Okay, so the airflow is good. Yes, you're not congested. It looks normal. So that's good. Now I'm going to be taking a peek or a look into your mouth. Okay, so open up wide and say ah. Okay. Do you have any pain in your throat or in your mouth or in your teeth? No? Okay, good. It looks like you take good care of your teeth. Okay. Yes, everything looks fine. Okay, perfect. Now I'm going to be testing your reflexes. So I need you to relax your body. Yeah, relax your arms and legs while I'm going to tap gently on your elbows and on your knees, okay? So I'm going to start with your elbows. Good. Good. And now your knees. Good. Very good. So your reflexes are normal. I'm going to be looking into your eyes for pupil dilation and contraction. Looks good. Can you look up for me? Thank you. Can you look down for me? Perfect. Can you look to that side? Thank you. Okay. Can you look to the other side? Thank you. Okay. Looks good. Your eyes might be just a bit dry. Yeah, I think your eyes are a bit dry. So I'm gonna be giving you some eye drops. So just keep your eyes open. Okay, other side. Okay, that should help with the dryness of your eyes. Now I'm gonna be testing your vision. This ear, is it the right way or the wrong way? Good. Right or wrong? Good. Right or wrong? Good. Right or wrong? Good. Is that the right or wrong way? Good. Is that the right or wrong way? Yes. Is this the right or wrong way? Okay. And is that the right or wrong way? Yes, good. Very good. Okay, so I got the results back from your blood test, and it looks like you're low on vitamin B12 and you're also low on iron. So I'm going to be giving you a shot of vitamin B12. I'm just going to be extracting, and I'm going to inject it into your shoulder, okay? Perfect. And now I'm going to give you your flu shot in your other shoulder. So I'm just going to extract and inject it into your shoulder. Perfect. And here are some iron pills for you. It's very important that you take them. Yeah, take them every morning. Take one right now. Perfect. So I'm just going to be writing a small report from your visit today. Everything looks very good. I don't think you have anything to worry about. But it's always good to come in for a checkup. So thank you so much for coming in today. Do you have any questions? Yeah, the B12 shot, it should work like immediately, but the full effect won't appear until after a few months, okay? Yeah, I advise you to come back for another shot in 1 month, okay? Perfect, perfect, perfect. So thank you so much for coming in. Feel free to come back if anything changes or if you are worried about anything at all, okay? But for now, have a wonderful day or a good night wherever you are in the world. Okay, goodbye. Hello and welcome in for your doctor's appointment. My name is Dr. Cami and I will be helping you today. Let's see here, let's see, okay. So I'm gonna have to take some information from you. So what is your full name? Okay. Your date of birth? And your home address? And what is your phone number? I see, okay. Thank you very much. So it looks like you were booked for just a checkup. Anything else? A flu shot? Okay, so a thorough checkup and a flu shot. Okay. I can definitely do that for you. I'm just going to ask you a few simple questions first. So, how is your diet like? Okay. Do you work out? Okay. And how often? Okay. And how much sleep do you get each night on average? Okay. Yeah, that can be improved. Perfect. I got everything I needed. Okay. So first I would like to take a height and weight of you, so if you can go and stand over there. Yeah, just stand against the wall and it will measure automatically. Okay. Let's see. Okay, perfect. You can come back and sit down again. Thank you. Nothing to worry about there. So now I'm going to take your temperature. I have this forehead measurer. So I'm just going to sit still. I'm just going to measure. Okay, let's see. Perfect. Very, very good. Now I'm gonna take a listen to your heart and your lungs. Just breathe normally. Very good. Okay, can you turn around for me? I'm gonna listen to your lungs. Thank you. Now take a deep breath in through your nose and out through your mouth. very good. So your lungs and your heart is sounding normal. Now I'm going to be checking your oxygen levels. Okay. So can you reach out a finger for me? Thank you. I'm just going to place it there. Let's see. Okay. Perfect. So you have enough oxygen in your blood. Your pulse is also good. So that's very, very nice to know. Now I'm going to be taking your blood pressure. Okay, so I'm going to be wrapping this cuff around one of your arms. There we go. And I'm going to be using this machine. Now you just relax for me, please. Just relax, 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 relax. Okay, very good. Perfect, that looks normal. I think I'm now going to be checking your reflexes with this hammer. So I need you to just relax your body. Relax your body, don't be tense. I'm gonna tap very gently on your elbows and on your knees, okay? So I'm starting with your elbows. Good. Other side. Good. And your knees. Good. Other knee. Very good, very good, very good. Very, very good. I'm now going to feel your abdomen. Let's see, let's see, let's see. Do you have any pain in your stomach or your abdomen? No? Okay, so I'm just gonna be tapping. Let me know if anything feels uncomfortable or painful. Is it okay? Good, 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 good. Okay, very good. I'm going to be feeling around your face as well. So just relax your face for me. And I'm going to feel your forehead. Can you close your eyes? Thank you. I'm just going to be tapping on your eyelids. Okay, you can open your eyes again. I'm gonna feel down your nose. Okay, and your temples. Okay, and your jaw. Okay, I'm gonna feel for your lymph nodes to see if anything's enlarged. And your collarbone. Okay, no enlarged lymph nodes, so that's good. Can you tilt your head downwards slightly? I have to feel your scalp as well. Okay, thank you. Okay. So now I'm just going to be tapping on your sinuses, so let me know if anything feels painful. It's just to know if you have like a sinus infection or something like that. So I'm just going to be tapping gently. Any pain? Good. Any pain? Okay, good. Now I want you to close your eyes for me and let me know when you feel this roller touching your face, okay? Very good. Again. Good. Again. Good. One more time. Very, very good. Okay, so the next thing that we are going to do is a couple of facial tests. So can you raise your eyebrows for me? Thank you. And can you frown? Very good. Can you puff out your cheeks? Good. I'm gonna feel that. Very good. Okay. So now I'm going to be looking at your eyes with this light. It's a bit bright, so don't look directly into the light. Look at the wall behind me, okay? Okay, good. Very good, okay. So your eyes, your pupils seem to be dilating and contracting as they should be. So that's very good. Now I would like you to follow my finger, okay? Using only your eyes, don't move your head, just follow my finger. Perfect. Now let me know when my fingers leave your field of vision. Now you can look at my nose, okay? And let me know when my fingers leave your field of vision. Good. 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 Perfect. Very, very good. So now I'm going to be looking into your ears with my light. So just sit still for me. And I'm going to turn on my light and look into this side first. Okay, I see a bit of a build-up there. Other side. Okay, yeah, same here. Looks okay, just a bit of a build-up. Okay, nothing that I can't fix. So I'm going to just clean out your ears very quickly. I'm going to be using this oil. Okay, so I'm going to be using this oil and I'm just going to be applying it first on this side. Perfect. And now on the other side. Very good. Okay, and now I'm going to be using these Q-tips and clean out your ears. other side. Okay, perfect. So now I'm going to just test your hearing with this pen. Close your eyes and let me know which side you can hear the pen clicking on, okay? Perfect. Okay. 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 Okay, now tell me how many times you hear it clicking, okay? Good. 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 Very, very good, very good. So your hearing is fine. I'm also going to look into your nose. So can you tilt your head back slightly? Thank you. I'm just taking a little peek into your nose. Okay, it looks good. Yeah, you have good airflow. Very, very good. No redness, no swelling. Good. I want you to do a quick smell test for me. So I have some scented water and I want you to smell this for me, okay? What does it smell like? Yes, it's mint. Very good. What does that smell like? Yes, it's coffee. And last one. What does it smell like? Yes, very good. It's citrus. So you did very, very well. Now I'm going to be looking into your throat, your mouth and your throat. So say ah for me, reach out your tongue and say ah. Thank you. I'm just getting a bit close. Okay, looks normal. Could you maybe test your taste for me? Yeah. So I want you to taste this. Just take a sip. Good, good. What does it taste like? Yes, it's coffee. Another one. If I can open it. What does this taste like? Take a sip, take a sip, take a sip. What does it taste like? What does it taste like? Yes, you are correct. It is vanilla. And final one. Take a sip, take a sip, take a sip. What does it taste like? Yes, it's salty caramel, very, very good. Now I want you to just do a couple of things for me, okay? I want you to close your eyes and I want you to touch your finger to your nose like so. Okay, and on the other side as well. Can you do that? Good, good, yeah. Perfect, perfect, okay. Now I want you to squeeze my hand as hard as you can. Good. Other side. Very, very good, very good, very good. Can you flip your hand like this as fast as you can? Good, and the other side. Perfect, perfect, perfect. Now shrug your shoulders like this and I'll try to press them down. Very, very good, okay. So the last thing remaining is your flu shot. So I'm going to extract the fluid. There we go. And I'm going to inject it into your shoulder. Very good, very good. That wasn't too bad, was it? No? Okay, so you're done. I'm just going to be writing a report. But you passed all of the tests with flying color. Perfect. So thank you so much for coming in, and just book an appointment if anything should change or if you want to get checked out again, okay? So thank you so much for coming in, and I hope you have a wonderful day or a good night wherever you are in the world, okay? Okay, goodbye. Hello and welcome to the clinic. So just sit down, please. I'm Dr. Cami. Nice to meet you. So you are here for the medical experiments, am I correct? Yeah. So you signed up for this voluntarily? Okay. Yeah. We thank you so much for your participation, obviously. I'm gonna need some details from you. So what is your first and last name? Okay. And your date of birth? Okay. So I'm gonna find you in the system here. Okay, it seems that you are experiment number 626. Yes, experiment number 626. Perfect. So this will not include any risk for you. There's no danger involved at all, but you can notice some strange side effects, maybe even some tingles, some people have said. So let's hope for the best, okay? I'm just gonna start doing what I'm gonna do, okay? And just sit back and relax as best as you can. Okay, now let's see here. Okay, do you mind if I touch your skin? No? Thank you. Okay. Okay. Now can I see your hands, please? Thank you. Okay, and where is there it is. So I'm just gonna apply some to your hands. Okay. Let's see. Okay. Okay. Open your mouth for me, please. Thank you. Okay. Just breathe normally. Okay. Within normal range, but a bit fast. So let's give you some medicine. Take this. That should do the trick. Yeah, that should do the trick. That should do the trick. Okay. Okay, now reach out an arm for me, please. Thank you. Relax, relax, relax. Okay. Okay. Taking a note of that. Now, if you would please reach out a finger for me. Thank you. Let's see. Okay. Perfect. Now, can you look at my nose, please? Yeah, just look at my nose. My nose. Don't look at the lights. Now look at the lights. Can you tell me which light is brighter? This one? What about now? This one? Okay. Yeah, I'm just gonna... You have to keep your eyes open, okay? Keep them open, keep them open. Keep your eyes open. Keep your eyes open. Okay. So I'm just gonna... Okay. I'm just gonna inject this to different parts of your face. Okay. Perfect. And now can you count these numbers for me? Yeah, count them. Okay. Now count them again. Okay. Count them again. Perfect. Count them again. What is that number? What is that number? That number? And that number. Okay. Do you find this light to be colder or warmer than this light? Okay. Do you find this light to be colder or warmer than this light? Okay. And do you find this light to be colder or warmer than this light? Okay. What is this number? And what is the shape? Okay, good. Okay. Just placing this on your head. Okay, now I want you to tell me if it's my finger touching your face or whether it's this fake hand, okay? Close your eyes, close your eyes, close your eyes. Finger or hand? Good. Finger or hand? Good. Finger or hand? Very good. Finger or hand? Good. Finger or hand? Good. Finger or hand? Good. Finger or hand? Okay. Okay. Now I'm just gonna, if you can relax your knees for me. Yeah, relax your knees, please. Okay. Okay. So I have these two. Okay, which one is purple and which one is pink? This one is pink. Okay, follow the pink one. I'll switch to the purple one. Okay. Okay. Now, I'm just gonna be doing some measurements. Okay. 10 to 20. Okay. Strange. Okay. Gonna have to write that down. And I'm just gonna be removing this. Okay. Yes. Whoops. Can you open your mouth? Yeah, I'm just gonna take this swab from your cheek. On the other side. Thank you. And I'm gonna place it. Okay. Now tell me if you can hear this. Okay, good. Can you hear this? Now close your eyes, and let me know which side you can hear it on. Good. 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 Okay, very good. Perfect, outstanding. I'm sorry, but I'm not allowed to reveal how you're actually doing, so these are just like positive affirmations, to be real with you. Yeah, no, it's, of course, if we discover anything like seriously wrong with you, we will have you referred further down the line, but for now, that's not an issue. Okay. Look at this. Okay. How does this make you feel? Uncomfortable, relaxed, or nothing at all? How did that make you feel? Yeah, how did it make you feel? Okay. So that was the final test. And I'm going to be writing a report now. And I don't know why you volunteered for this, but thank you for doing so. Yes, so your name will be, you will be anonymous. It will be, yeah, your name is Experiment 626. So that's what we are going to use. So no one can trace this back to you. Okay, now wait a second. I'm just gonna check something real quick. So just stay very, very still. Stay very, very still. Okay. So response to heat. Okay. Now you're good to go. Thank you so much for coming in and have a good Christmas. Yeah. Goodbye. Hello, 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 and welcome into the doctor's office. I'm Dr. Cami, nice to meet you. So you were here for a general checkup, is that correct? Okay, perfect. So I'm just gonna have to take some information from you, okay? Perfect. So what is your first and last name? Okay, and what is your date of birth? What is your home address? And the zip code for that is... okay. Perfect. And what is your phone number? Okay. And do you have a preferred emergency contact? Yeah. Do you have their number as well? Perfect, perfect, perfect. Thank you. So I'm gonna be starting the exam with just asking you some questions about your general health, okay? So how much sleep would you say you get each night on average? Yeah, how many hours? Okay. That's not terrible, but it's not perfect either. And what is your diet like? Okay, I see. Okay. Yes. And do you get any exercise? Okay. how many hours a week would you say? Okay. And what type of exercise is it? Okay. Okay. Amazing. So the first thing that I'm going to do now is that I'm going to be putting on some gloves, okay? Just going to be putting on some gloves. And I'm going to be applying some hand sanitizer to my hands. Is it okay if I feel your face a bit? Yeah, I just want to check your face. Thank you. I'm just feeling around for any lumps or bumps, looking for any cuts, any scars, any wounds. Is it okay if I use my light? Thank you. It's a bit bright, so it gives me a better view. Okay. The skin looks a bit dry. Do you moisturize? You do? Do you hydrate? Okay, you should be drinking a lot more water. Yeah, you need a lot more water. Water is very, very important to the skin, okay? And also all of your bodily functions. So, yeah, drink water. Otherwise, your skin looks healthy. I'm just gonna check your scalp. Okay. So everything seems normal. Would you mind tilting your head back so that I can feel your lymph nodes? Thank you. Perfect. Everything seems normal. I'm just going to be taking a temperature of you. So I'm going to be placing this under your tongue. Close your mouth. Okay. So you don't have a fever. That's good news. That's always good news. So now I'm going to be listening to your heart, okay? Just breathe normally for me. Okay, that sounds good. Your heart rate is a bit fast, but that could be because you're nervous or because you are a bit dehydrated, okay? Now I'm going to listen to your lungs, so if you can turn around for me, please. Thank you. Now take deep breaths in through your nose and out through your mouth. Perfect. So both your heart and lungs seem to be in perfect shape, okay? Nothing to worry about at all. Now I'm going to be taking your blood pressure, okay? So I'm just going to be placing this cuff around your arm, like so. Now just relax, 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 okay? Relax, 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 relax. Okay, so your blood pressure is perfect. It's perfectly normal, okay? So that's good, that's very good, very, very good. And now I'm going to be measuring the levels of oxygen in your blood. So I'm going to be placing this on your finger. And I'm going to be checking. Okay, it says 99%, 99%. That's very, very good, very, very good. Very good, very good, very, 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 very good. That's very good, okay? So your vitals are all good, nothing abnormal at all, nothing to be worried about. But I would like to test your eyes as well, okay? So I'm going to be shining this light into your eyes, and I want you to look at the wall behind me, okay? Don't look directly at the light, okay? So first this side. Okay. 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 Perfect. Other side. Okay, perfect, perfect, perfect. Now I want you to look at my nose, okay? And tell me which side is moving. Good. 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 Perfect. Good. Both sides, yeah, both sides. Amazing, amazing, amazing. Very, 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 very good, very good, very good. Now I want you to follow my finger using only your eyes. Yeah, don't move your head, use only your eyes, okay? Okay, very good, very good, very, 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 very good. Now can you tell me when my fingers enter your field of vision? Good. 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 Perfect. Now can you tell me when my fingers leave your field of vision? Good. 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 Amazing, 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 amazing. That's very, very good, very good, very good. So now I'm done with all of my tests. I'm going to be removing my gloves. Okay. And I'm going to be writing down the conclusion, which is that you are in perfect shape, but you are perhaps a bit dehydrated, okay? I'm also going to order a blood work for you. So if you go back to the waiting area, they will call you in for a blood test just to check your vitamins and minerals and all that good stuff, okay? So I'm going to write that down. Okay, I'm gonna write that down. And feel free to schedule an appointment at any time if you feel like anything changes, okay? Yeah, so that's it. And for now, have a good day or a good night wherever you are in the world. Okay. Goodbye, goodbye. Oh, hello. welcome in. Just take a seat, please. Take a seat. Can I have your full name? Okay, and your date of birth? And what brings you in today? You want a general checkup? Okay, that's fine. Have you noticed any symptoms that are bothering you? You have some restless legs at night. Okay, I see. That can be very annoying and it affects your sleep, so it's important to get that checked out. Do you use any medications? Okay. And do you have any allergies? Okay, seasonal allergies. Do you have any allergies to medications? Okay. And what about stress? How's your stress levels been? Have you been feeling more stressed, less stressed than usual? Okay. So that's all I need for now. I did have a look at your chart and I could see that you had some blood work done a week ago. Yeah, so the results they have come back and it shows mostly fine tests, but you are a bit low on B12, and B12 is very important for nerve function, nerves and muscles, so that could explain the restless legs, but we can't be quite sure. Okay. Usually the iron is what's low when you have restless legs, but you have a normal level of iron in your blood, so that's very reassuring and very good. Can I get your height and your weight? I forgot to ask you about that. Okay, your height is okay, and your weight. Okay, perfect. So I think the first thing we are going to do is give you a B12 injection, just because it might help your symptoms. We don't know for sure, but we can try. Okay, so I'm just going to be putting on some gloves. Are you scared of needles? No? Okay, good. I'm gonna be very quick and gentle, and it's going to be over in a second, okay? So I'm first just gonna be cleaning the area. Do you prefer your left or your right shoulder? Okay, so I'm just gonna clean here. Okay, good. And now for the shot. Just try to relax, okay? It's gonna be very quick, I promise. Okay, 3, 2, 1. Perfect. Perfect, perfect, perfect. So let's start the examination, shall we? I'm gonna start by taking your temperature. So I'm just gonna measure your forehead temperature. Just sit still for me. Okay, one more time. Okay, just to be sure. Okay, that looks very good. Amazing. Now I want to have a listen to your heart and your lungs. Okay, so first I'm going to be listening to your heart, so just breathe normally. Okay, good. I'm gonna reach behind to your back, and now I want you to take deep breaths in and out for me, okay? I can do it with you, okay? Deep breaths in and out. In and out. In and out. Okay. So that sounds very, very good. Both your heart and your lungs sound fantastic. I'm gonna check your pulse just to see if it's regular. Okay, so if you can hand out your wrist for me. I'm just gonna be feeling your pulse. Okay. Yeah, that seems very irregular, which is good. And I'm gonna be taking your blood pressure. So I'm just gonna place this around one of your arms. Okay, good. Okay, now you have to sit still and relax for me. Try your best to relax, 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 and don't talk, don't talk. Okay, very good. It says 110/70, which is within normal range. I also want to measure the oxygen levels in your blood, so can you reach out your finger for me, please? Thank you. Just gonna place this there. Okay, let's see. Okay, very good. It's 97%. That's perfectly healthy, okay? Okay, so now I want to do a little physical exam of your face. I'm going to be feeling your face, your sinuses, your lymph nodes, okay? Is it okay if I touch your face? Okay, thank you. So just be feeling. Does anything hurt when I press here? Okay, what about here? No, okay. I'm going to be feeling your lymph nodes. Good, good, good. Now I want to feel your abdomen. Is that okay? I'm just going to palpate very gently. Tell me if anything feels uncomfortable, okay? Okay, good. Does this hurt? Okay. What about this? Does it hurt? Okay. Now I'm gonna be feeling underneath your ribs, so I need you to take a deep breath in for me and hold this for a few seconds, okay? Deep breath in. And out. You can breathe again. That seemed perfectly fine to me. I'm gonna be pinching your fingernails now just to see if the color returns like it should, okay? So I'm gonna pinch the finger on this hand. Give me a hand, thank you. Looks good, other hand. Perfect, very, very good. Okay, now I'm going to be taking a look at your skin with my magnifying glass. And I'm also going to be checking your scalp and your hairline, okay? So I'm going to start with your face. Just taking a look at your skin. See if there's anything suspicious going on. Everything seems okay. Okay. Can you lean forward so that I can check your scalp? Thank you. Okay. That also looks good. Just going to be taking a couple of notes. Good. Now I'm going to be examining your eyes. I first want you to just close your eyes, open your eyes, close, open, close your eyes, and open your eyes. Very good, very good, very good. I want to be looking with my light, and what I'm going to do is I'm going to be looking for some eye strain. So if you, for example, use screens a lot, you can get red and dry eyes, and it's not very good. So I'm going to check for that. Just look at my nose. Okay, at least your pupils are responding like they should. And now I want you to look up for me. Look up, look up, look up, look up, look up, look up, look up. Good. Now look down, look down, look down, look down. Look to the side. Okay. Look to the other side for me, please. Perfect. That's all good. Now, can you follow this pencil for me with your eyes, using only your eyes? Don't move your head. Just follow it with your eyes, okay? And tell me, can you see the pencil better when it's close or when it's far away? Close or far away? Which one do you see more clearly? Close or far away? Okay, good. I'm gonna be testing your peripheral vision now, so I want you to look at my nose and let me know when you can see my fingers enter your vision, okay? Okay. Good. 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 Very good. Perfect. Yes. Yes. Very good. Now I'm going to be covering one of your eyes, and I'm going to show you a number with my fingers, and I want you to tell me how many fingers I'm holding up, okay? So I'm first going to be covering this eye. Okay. How many numbers? How many fingers, I mean? How many fingers? How many fingers? How many fingers? Good. Now the other eye. How many fingers? How many fingers? How many fingers? And how many fingers? Perfect. Perfect, perfect, perfect. Now I want to test your color vision. So if you can tell me the color that I'm pointing to, just tell me the name of the color that I'm pointing it to, okay? What color is this? Okay, what about this? Good, what color is this? Good, what about this? Perfect. There's nothing wrong with your color vision either. Now I want to be looking into your throat with my light and just have a check to see how your throat is doing. So can you open up, please? Thank you. Say ah. Okay. I can't see any redness or any plaque. You seem to have a good oral hygiene as well. Looks healthy. Yes. Very good. Now I want you to swallow for me while I hold your throat, okay? Can you swallow? And again. One more time. Good. You're cooperating very well and I appreciate it, okay? Is it okay if I take just a quick cheek swab? Yeah, and send it in for testing. We're testing some stuff and we need participants. Okay, perfect. So I'm gonna be using a Q-tip. And I'm just gonna be open up again. I'm just gonna be swabbing right here. Right there. And I'm gonna add that into the test bin. Now I'm gonna be looking into your nose with my light. So, can you tilt your head backwards slightly so just I can have a good look? I'm looking for any swelling, any redness. You seem to have a good airflow in both nostrils. So that's good. Okay. Nothing concerning about that. Yes, I want you to smell something for me. So, I'm gonna be opening this up. These are some pearls, or what you call them. Okay, can you smell this for me? And tell me what it smells like. Smell it, smell it, smell it. What does it taste like? Okay, correct. This is in fact citron, so that was perfect. I'm gonna be looking into your ears. Yeah, I'm gonna start on this side. Just looking. It looks very healthy indeed. Okay, other side. A bit of earwax. That's to be expected. Other than that, it looks good. It looks very good. Okay, so I'm gonna perform a hearing test on you as well. So I'm gonna say some numbers, whisper some numbers into each ear, and I want you to repeat them back to me, okay? Okay, perfect. 5, 2, 6. Good. 1, 9, 2. Good. 3, 9, 4. Yes. 6, 6, 7. Perfect. Very good. And now I want you to close your eyes and I'm going to be making a sound and I want you to tell me which side you can hear it on, okay? Okay, so close your eyes. Close your eyes. Which side? Good. Which side? Perfect. Good. Good. Very good, very good. There's nothing wrong with your hearing. Yes. Now I want you to make some facial expressions for me. So if you can first raise your eyebrows. Good. Can you squeeze your eyes shut? Yeah, squeeze them shut. Very, very good. Now can you smile? Yes, show me your teeth. Very good. Puff out your cheeks. Just gonna feel. Good. And now stick out your tongue, please. Okay, good. We're done with that. Yes. Now I'm gonna be doing a small sharp or soft test with you. So I have this sharp side and this soft side, and I'm going to be touching your face, and I want you with your eyes closed to tell me whether you feel the soft or the sharp side touching your face. Okay? Okay. Good. Good. Yes. Yes. Good. Yes. Yes. Good. Perfect. And now I'm going to be stroking your arms with this brush, and I want you to tell me whether or not it feels equal on both sides, okay? Okay. So I'm going to start with this arm. And now the other arm. Does that feel equal? You think so? Okay, good. Now, can you shrug your shoulders for me like this? I'm gonna try to press them down, and don't let me. Good. Now, can you turn your head against my hand? I'm gonna try to press it. You have to resist. Now press your head against this hand. Resist. Very good. Now, can you show me your range of motion with your neck? Yeah, can you bend your neck backwards? Forwards? Good. Side to side. And very good. You have a good range of motion with your neck. So that's excellent. Can you squeeze my fingers? Squeeze my fingers as hard as you can. Okay, that was good. Can you squeeze me with your other hand? Perfect. So you have good grip strength, which is good. Now can you close your eyes and touch your nose like this? Okay. Good. And now with your other hand, yeah. Very good. Now can you look at my nose? Look at my finger. Look at my nose. Look at my finger. Look at my nose. Look at my finger. Look at my nose. Look at my finger. Very good. Now I want you to tap each finger against your thumb like this. Good. Can you do it with your other hand as well? Perfect. Amazing. Now I'm going to be tracing a shape with my light, and I want you to tell me which shape I'm tracing, okay? Yes, that was a heart. Circle, good. Yes, that was a triangle. Okay. So I'm going to be taking a couple more notes. Yeah, you're doing very good so far. And we are nearly done. There's not very much left. Okay. Now I'm gonna be testing your reflexes with this hammer, and I'm gonna tap once on each of your elbows and once on each of your knees. Okay, so relax your body, relax your body. Okay, start with your elbows. Good. Other side. Good. And your knees. Good. Your other knee. Very good. Your reflexes are normal. Yes. So physically I can't find anything wrong with you. But I want to be measuring your facial symmetry real quick, just to see that everything's where it's supposed to be and that it's not too asymmetrical, okay? Yeah. Let's see. Okay. Okay. Yeah. So nothing unusual then. I don't see any reason to worry about asymmetry. Everyone's a bit asymmetrical. It would look very weird if we were the same exactly on each side. So that's good. Is it okay if I ask you a couple of questions about your mental health? Okay, good. So how have you been feeling emotionally lately? Okay. Have you been experiencing more stress than usual? Okay. What about anxiety? Do you feel a lot of anxiety? And how have you been sleeping? Yeah, I understand the restless legs makes it difficult. Yeah. Okay. And have you noticed any changes in your energy, your motivation, what else, your concentration, anything like that at all? Okay. And when things do get difficult, do you feel like you have the support you need around you? Yeah, that's very important. Okay, good. Okay, so my conclusion is that I didn't find anything wrong during this examination. What I will do is... I think I'm gonna write you a prescription for magnesium. You can also buy them free at the drugstore without a prescription, but you get them cheaper when I prescribe them for you, okay? So I'm gonna give you some magnesium that very often help with the restless legs. Good. And besides that, it's just important that you drink enough water because it's very hot right now and you have to stay hydrated, okay? Very important. Also, if anything does change, like you notice anything new symptoms, or you just need reassurance about anything, then I want you to come back here. Yeah, it can be either physical symptoms or psychiatric symptoms. It's just important that you seek help, reach out, okay? Okay, good. So thank you so much for coming in today. Yeah, it's good to have just a checkup once in a while. So do you want to schedule a new appointment right now, or do you want to wait? You want to do it yourself later on? That's perfectly fine. I just now wish you a very good day, or a good night wherever you are in the world. Okay, goodbye. Hello and welcome into the doctor's office. My name is Dr. Cami and I'm going to be assisting you today. So yeah, just take a seat please, and we will start by getting some information from you, okay? So what is your first and last name? Okay, what is your date of birth? Okay, and your social security number? Good. And what brings you in here today? You want a checkup? Okay, a general checkup. Do you have any symptoms that are bothering you? Okay. So you have a headache that's been going on for a while. Yeah, how long? Okay. Okay, so we are going to check that out. Any other symptoms? Red and itchy eyes. Okay. Good. Okay, and do you have any allergies? Okay, you have seasonal allergies. Any allergy to medications? Okay. And are you taking any medication currently? Okay. Okay, good. So I think we are ready to start. First, I would like to just take your weight. Do you know your height? Okay. Good. If you can just step over there by the scale, and I will be getting ready while you do so, okay? So I'm just gonna put some hand sanitizer on. Okay. And some gloves. Okay. Now I'm just gonna check the scale to see. Okay, yeah. So you can come back here and have a seat again. And the first thing that I'm going to do is that I will be measuring your temperature. I have all of my tools right here. Okay. So I'm just going to be checking whether you could potentially have a fever. So this measures the temperature on your forehead. Okay, so I'm just gonna Okay, good. Now let's see. Okay, 37 degrees Celsius. So that's very, very good. No fever. Yeah, so I'm going to be checking your vital signs, and I'm going to start by listening to your heart, okay? I'm going to be listening both to your chest and to your lungs. Is it okay if I pull down your shirt slightly? Okay, thank you. Okay, very good. Now can you turn around for me so that I can listen to your lungs? Thank you. Now I want you to take a deep breath in. Good. And out. Good. Deep breath in. And out. One more time. Deep breath in. And out. And one last time. Deep breath in. Hold it. And out. Very good. So you can turn straight forward again. I can't hear anything wrong with your heart or your lungs. So that's very good. That's what we want to see. And I'm going to be measuring your blood pressure. So I'm going to be placing this cuff around one of your arms. Do you have a preferred arm? Okay. Just around there. Good. Now relax. Relax, relax, relax. Okay. Okay. Very good. 117/86. So that's perfect. Very good. I'm just going to be taking a quick note, okay? Let's see. Okay, good. And now I will be checking the oxygen levels in your blood, just to make sure that you have enough oxygen in there, okay? So can you please reach out a finger for me? And I'm going to be placing this on your finger. Thank you. Let's see. Okay. Yeah. Perfect. 98%. So the normal range is within 95 to 100 approximately, okay? So you are definitely within the limit, which is excellent. Now I want to check your reflexes using this. So I need you to relax your body, okay? Just let go of any tension in your arms and your legs, because I'm going to be tapping on your elbows and your knees, okay? So just relax, 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 okay? Good. So I'm going to start with your elbows. Good. Other side. Very, very good. And now the knees. Okay. Other side. Perfect. So your reflexes are working wonderfully. Now I would like to palpate your abdomen. Yeah. So if you can pull up your shirt again slightly. Thank you. I'm just going to be feeling around. Have you had any tummy aches recently, or any other issues like constipation, diarrhea, pain in general? No? Okay, good. Okay, so your abdomen seems perfectly fine. I want to test, or not test, but just look at your face a bit, okay? Just checking for any lumps, bumps, scarring, wounds, anything at all, okay? So, is it okay if I feel your face? Thank you. So, I'm just gonna be gently feeling your forehead, your nose, your cheeks. Okay. And your jaw. I'm checking your lymph nodes now. Okay, and your collarbone. Okay, so no signs of any enlarged lymph nodes, which is very, very good. I'm gonna be performing a small test on you. Okay, so I have 2 brushes. I'm gonna start with one brush, and I want you to close your eyes and let me know whether you can feel the soft side or the sharp side of the brush, okay? Perfect, so close your eyes. Close your eyes. Okay. Good. Good. Yes. Yes. Good. Good. Perfect. Okay, so now I'm going to be using both brushes, and I want you to let me know whether you feel the larger brush or the smaller brush touching your face, okay? So close your eyes again. Close your eyes again. Okay. Yes. Yes. Good. Okay. Okay. Perfect. So you performed very well on that. Now I would like you to do some facial expressions for me, okay? So I want you first to just smile. Good. Now can you puff out your cheeks? Okay, hold them like that while I try to press. Good. Okay, now can you scrunch up your nose like this? Perfect. Can you raise your eyebrows? Very, very good. And now I want you to shrug your shoulders, and I'm going to try to press them down, and you're going to try to resist, okay? Okay. Very good, very good, very good. Yes, so I'm gonna be taking another note of the progress of the exam. Okay. Good. Do you have any issues with your scalp? Any itching, soreness? Okay. Mind if I just check it out real quick? Okay, good. Thank you. So I'm just going to be feeling your scalp area. Looking around. Okay, so your scalp seems normal, nothing unusual there. A bit of dandruff, but that's perfectly fine, okay? Now I want to check your eyes, okay? I first want to just physically feel them, okay? So I want you to close your eyes. And I'm just going to be tapping on your eyelids. Okay, now open, good, close, good, and open. Very good. I'm gonna be looking at your eyes with this light. Okay, so just look at my nose. Okay, while I check for pupil dilation and contraction. Okay, so good. Okay, everything normal there. Now I want you to look up for me. Look up. Good, look down. Okay, look to the side. The other side. Okay, good. That's perfect. Can you follow this pen for me with your eyes? Now keep your head still and just move your eyes and follow this pen, okay? Very good. Very good. And now I want you to look at my nose again and tell me when my fingers leave your field of vision, okay? Good. Perfect. Very good, okay. And now do the same thing, look at my nose and let me know when my fingers enter your field of vision, okay? Okay. Good. Yes. Amazing. Awesome, okay. Perfect. I want to check your vision a bit closer, so I've got this eye chart. And I want you to tell me, because you can obviously see that there are a lot of E's here, and all I want you to do is tell me whether the E I'm pointing at is the right or wrong way, okay? Good, okay. Right or wrong way? Yes. Right or wrong? Good. Right or wrong? Good. Right or wrong? Good. Perfect. Yes. Okay, very good. So you passed that with flying color. I also want to check your color vision really quick. So I have this little thing, and I'm gonna put it very close to your eyes, and you let me know what color you see, okay? Okay, so what color is this? Orange, good. Now what color is this? Yellow, very good. What about this? Pink, okay, one more. Blue, 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 very, very good. Very good. Okay. I want to look into your nose and your mouth and your ears with my light, okay? I'm gonna start by looking up your nose. Okay. Can you tilt your head slightly backwards? Thank you. Okay, seems fine. I'm gonna test your sense of smell, okay? So I have these Q-tips, and I have a solution, 3 different solutions. I'm going to be spraying on the Q-tip, and you let me know what it smells like, okay? So I'm going to start with this. Okay, what does it smell like? Peppermint, very good. Okay, and now for the second scent. What does it smell like? Coffee, perfect. And now for the final scent. Okay. What does this smell like? Take your time. Lemon, 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 very, very good. Very good. So there's no problem with your nose and your sense of smell. Not at all. And now let's see. Now I want to look into your mouth. Okay. So open up wide and say ah. Okay. Okay, so your mouth looks good, your teeth look healthy, your throat, I can't see any redness, no swelling or anything like that. So that's very good. I'm gonna give you some pastels to taste, to check your sense of taste, okay? So I'm gonna start by giving you this. Eat it. Chew it. Chew it, chew, chew, chew it. What does it taste like? Banana, good. And now this. Taste it. Chew it, chew it. What does it taste like? Strawberry, perfect. And the final one. Eat it and chew, 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 chew it. What does it taste like? Yes, it's vanilla. You're doing very well. I haven't found anything strange or out of the norm as of now anyways. So I'm just going to be taking some notes. Okay, good. So now I will be looking into your ears. Okay, so can you turn your head this way for me? Thank you. Okay, so I'm just looking. You have a bit of build-up of earwax, but no swelling, no redness. Okay, other side. Now turn your head that way for me. Thank you. Okay, same here. A bit of build-up of earwax, but nothing serious. Okay, good. So what I want to do now is just gently clean out your ears. Is that okay with you? Okay, good. So I'm going to be using these Q-tips, but I wouldn't advise using them at home, okay? Because you could actually just do more damage than good. Yes. But I'm going to be using a Q-tips right now. Okay. And I'm going to start on this side. Good. Now on the other side. Okay. Perfect. So I'm going to have another look into your ears. Okay. Yeah, that looks much better. Other side. Okay, looks good, looks good, looks good. Looks very, very good. Okay. So I want to test your hearing. I'm just going to be repeating some words, okay, into each ear. Now actually we're going to do numbers. I'm going to be whispering some numbers into your ears, and I would like you to repeat them back to me, okay? Perfect. 1, 5, 2. Good. 3, 6, 9. Very, very good. Now on the other side. 10, 1, 5. Very good. 11, 2, 3. Perfect, perfect, perfect. So there's nothing wrong with your hearing at all. Yeah. So when it comes to your symptoms, I think I'm gonna try, because when I looked into your eyes, I noticed they were a bit red, and you said you had some itching, right? Yeah. So what I'm gonna try to do is I'm gonna be giving you some eye drops for allergies to check if this is just hay fever, because my suspicion is that it is hay fever you're struggling with, okay? Okay, so I'm gonna be dropping some into your eyes right now. So if you can bend slightly backwards. Thank you. Good. Now on the other side. Okay. Now let's give it 2 minutes and see whether it works. In the meantime, I want to just take a few quick measurements of your face, just to see if there hasn't been any changes since last time we measured you, okay? So I have this measuring tape. Okay. Now just sit still. I'm gonna be very quick. Okay. Good. Good. Yes. Okay. Okay. So your facial features seems to be the same as last time. So, you know, there is a condition where you can get like a tumor on your pituitary gland, and it will cause your nose and your jaw or chin and hands and feet to grow. So I just like to check like whether there's a problem. Now, regarding your headaches, I couldn't find anything wrong on the examination, but I think because you have had this problem for a while and it's bothering you a lot, I think I'm going to be referring you for an MRI. Yeah, so that's what I'm going to do now. It might take a little while before you get your appointment, but I'm going to write that it's kind of urgent, okay? So you will get prioritized. Okay, good. Now, how are your eyes feeling? Yeah, they're looking much better. Perfect. Yeah, so it's just hay fever. I have it, I know what it's like. It can be a real pain. Okay, but I'll prescribe you the eye drops and also some tablets you can take, okay? Okay, very good. So I think that's it for this appointment. Do you have any questions? No? Okay, well, thank you for coming in, and I hope everything improves, and I hope you have a good rest of the summer, okay? Yeah. So have a good night. Okay, so have a good night or a wonderful day wherever you are in the world, okay? Okay. Goodbye. Hello and welcome into the doctor's office. My name is Dr. Cami and I will be your doctor for today, okay? So can I please have your first and last name? Okay. And your date of birth? Okay, and why did you come in here today? You just want a checkup? Okay. Do you have any symptoms that are worrying you? Okay. Yeah, we'll check that out. Do you use any medications? You do, okay. And what do you take that for? Okay, yeah. Perfect, thank you so much. So now let's get started with the exam. So I'm gonna be first just putting on some gloves, because we don't want anything contagious from either you or me. Okay, the first thing I'm gonna do is I'm gonna be taking your temperature. So I'm going to be measuring your forehead temperature, so just sit still for me. Okay, now let's see. Okay, yeah, 37 degrees Celsius, which is perfect. That's perfect. And now I'm gonna take a listen to your chest. Listen to your heart. Okay, now sit still for me and breathe normally while I place this on your chest. Okay, perfect. Can you turn around for me so that I can listen to your lungs? Thank you. So now I want you to take a deep breath in through your nose and out through your mouth. Okay. Okay, good. Now I want you to take a deep breath in and hold it for 5 seconds and then breathe out, okay? Perfect. So breathe in and hold it. Okay, good. Breathe out. Very good. Okay, so you can turn straight forward again. Nothing abnormal with your heart, so I'm just taking a note of that. Okay, so now I'm going to be taking your blood pressure. Can you please reach out an arm for me? Thank you. I'm going to be wrapping this cuff around your arm. Like so. And now sit still and relax for me. Relax, relax, relax. You're doing great. You're doing amazing. Okay. Good. Good, good, good. So your blood pressure is 120/80, which is pitch perfect, okay? So you're doing amazing this far. I'm gonna measure the oxygen levels in your blood with this little thing. So if I can get a finger, thank you. Okay. Now let's see, let's see, let's see. Okay. So you have 99% oxygen in your blood, which is the way it's supposed to be. So no worries there, okay? Yeah. So I'm just gonna write that down. Okay. So now I would like to feel your face a little bit. Just start by feeling your face for any lumps, bumps, irregularities, scars, bruising, anything like that, okay? So just sit still. Is it okay if I get a bit close, and is it okay that I feel your face? Okay, perfect. So I'm first just checking the forehead area. Okay, and down the sides of your face. Okay, and your nose. Okay, no lumps or bumps. I'm checking your jawline. Okay, can you tilt your head slightly back so that I can feel your lymph nodes? Thank you. I'm just checking if anything's enlarged. And your collarbone. Okay, everything seems normal. Now can you bend your head slightly forwards so that I can feel your scalp? Thank you. Do you have any itching or dryness in your scalp? Okay. Yeah, I can see a little bit of dandruff, but not too bad at all. Okay, seems good. I'll take a note. Okay, so now I'm going to be feeling your abdomen. I'm going to be palpating, and you let me know if anything feels uncomfortable or painful, okay? Good, 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 good. Okay, so I'm just going to be feeling. Anything okay? Anything hurting, or is it okay? Does it feel okay? Okay, good. Very, very good. Okay, so your abdomen is very normal, no weird things going on. Okay, so now I'm gonna be checking your reflexes, okay? So I'm gonna be using this hammer. Now it's very important that you relax your body, okay? Relax your arms and legs, and I'm gonna be gently tapping on your elbows and on your knees, okay? Okay, good, 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 good. So I'm first gonna be tapping on your elbows. Good, other side. Good, and your knees. Good, other side. Perfect. Perfect, perfect, perfect. So your reflexes are normal, okay? Okay, so now I'm going to be looking into your eyes. I'm going to be looking into your eyes, and I'm going to be using this light. It's a little bit bright, so just don't look directly at the light, okay? Good. So I'm going to start by checking your pupils for dilation and contraction. Okay, other side. Okay, very good, very good, very good. So now I'm going to be testing your vision. So I want you to tell me if the E that I'm pointing at is the right or wrong way, okay? So I'm starting with the top one. Is that right or wrong way? Good. What about this one? Good. This one? Yes, good. What about this one? Okay. Now this one. The right or wrong way? Good. This one? Right or wrong way? Perfect. And this one? The right or wrong way? Perfect. And one final one. This one? Is that the right or wrong way? Good. Very, very good. So I'm also gonna ask you to follow my finger. Okay? I want you to don't move your head at all. Just follow my finger with your vision, your eyes, okay? Good. Very, very good. Now can you close your eyes? No, don't close your eyes. Can you look at my nose? Look at my nose and let me know which finger or which side is moving, okay? Look at my nose. Okay, tell me which side is moving. Good. Yes. Yes. Good. Good. Okay. Okay. Yep. Perfect. 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 Now keep looking at my nose. And now I want you to tell me when my fingers leave your field of vision. Okay? Yes. So, just look at my nose. Good. Yeah. Good. And good. Okay. And now keep looking at my nose. I want you to tell me when my fingers enter your field of vision. Okay? Good. Yes. Yes. Good. And perfect. Perfect. Very, very good. Taking a note of that. Okay, is it okay if I take a look into your nose and your mouth? Okay, thank you. I'm going to be using my light again, so tilt your head slightly back so that I can look into your nose. Thank you. Okay, looks good. Now I'm going to be looking into your mouth. So say ah. Thank you. Okay, no redness. No signs of any bacterial infection. Okay. Yeah, it looks normal. It looks normal. Now I'm going to be looking into your ears, okay? So I'm going to be first looking on this side. Okay. Yeah, seems fine. A little bit of earwax, but that's no problem. Okay, other side. Okay, same here. Looks good, good. Just a little bit of earwax. But we can handle that. You're supposed to have a bit of earwax, so no problem there. Good. I'm going to be testing your hearing, so what I want you to do is close your eyes. Close your eyes. And I'm going to be using some scissors on each side of your head, and I want you to tell me which side you can hear the scissors on, okay? Good. So close your eyes. Close your eyes. Let's begin. What side? Good. 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 Yes. Okay. Good. Perfect. Very, very good. And now I'm going to be whispering some numbers into your ears, and I want you to repeat them back to me, okay? 157. Yeah? 3, 2, 1. Yes. 10, 5, 7. Good. 9, 2, 1. Very, very good. Okay, so your hearing is perfect, and yeah, just as expected, I don't have any worries about your hearing at all, okay? So I'm just gonna write that down. Okay, so now we are going to be doing some facial tests. I'm first gonna be using this for a soft or sharp test. I want you to close your eyes and tell me if you can feel the soft side, or the sharp side touching your face, okay? Okay, perfect. So close your eyes. Close. Soft or sharp? Yes. Soft or sharp? Good. Soft or sharp? Good. Good. Yes. Yes. Good. Okay. Perfect. So your facial sensation is normal. So now I'm gonna be I'm gonna make you do some facial expressions for me, okay? So first I want you to raise your eyebrows like this. Good, okay. Now frown for me. Good. Puff out your cheeks. Good, keep them puffed out. I'm gonna try to press. Okay, feels good. And I want you to smile for me. Yeah, show your teeth. Perfect. And now I want you to shrug your shoulders like this. I'm gonna try to press them down and you're gonna try to resist, okay? Okay. Very, very good, very good. So now over to testing your sense of smell. I was not supposed to show you that. Okay, but close your eyes and let me know what this smells like, okay? Close your eyes. Okay. Smell. Take a smell, take a sniff, take a sniff, take a smell. Smell, smell, smell. Okay, so what did that smell like? Coffee. Yes, very good. And now for your sense of taste, I'm gonna give you a piece of gum and you're gonna let me know what it tastes like, okay? So close your eyes. I'm gonna be placing that into your mouth, like so. And now chew it. Chew, 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 chew it and taste it. What does it taste like? Yes, you are correct. It's strawberry. Strawberry, very, very good. Now I'm just going to be doing one final test. Okay, so I'm going to be using a lighter and I want you to close your eyes and let me know when you can feel the heat approaching your face, okay? Good, close your eyes. Good, one more time. Good, and one final time. Very, very good. Okay, so you have done amazing on this exam. So I'm going to be writing down a couple of things. Good, okay. So you definitely don't have anything to worry about. You seem to be in perfect health. But it was very good of you to come in here today. It's always good to have a checkup if you feel like it's necessary, okay? Yeah. You know your body better than I do, so only you can feel if something doesn't seem right, okay? Yeah. But thank you so much for coming in, and I hope you have a wonderful day or a good night wherever you are in the world. Okay? Okay, goodbye. Hello, hi, I'm Dr. Cami. Nice to meet you. So I'm going to be the one performing the medical exam on you today. So can I please get your information? Thank you. So what's your name? And what is your date of birth? What is your home address? And the zip code for that is okay. And your phone number? And your preferred emergency contact? Okay, what's their name? Yeah, do you have the number? Perfect. So I'm gonna start by just asking you some general questions about your health, okay? So how much sleep are you getting each night on average? Okay. And what is your diet like? Your diet and your eating habits? Okay. Do you get any exercise? You try to? Okay, that's good. No one's perfect. Okay, so I would like to start by you just go and step on the scale right over there. Thank you. Okay, so no changes in weight since last visit. Do you know your height? Okay. Perfect, so now I'm going to be taking your temperature. So I'm going to have to place this under your tongue and close your mouth. Okay, so you don't have a fever. You don't have a fever. Okay, that's very good. And now I'm just going to be taking a quick feel of your face, wearing my gloves. And I'm gonna have to use some hand sanitizer. And I'm just gonna be feeling around your face. Down your nose, your cheeks. I'm just checking for any lumps or bumps, or any scars or wounds. Can you tilt your head forward so that I can check your scalp? Thank you. Have you been noticing any itchiness in your scalp? No? Okay. Everything looks very good. Now can you tilt your head backwards so that I can feel your lymph nodes? Thank you. Perfect. Everything seems good. Okay, so now I'm gonna listen to your heart. And I want you to just breathe normally, okay? Okay, so your heart sounds very good. Normal heart rate, no arrhythmias, I don't know. Okay, can you turn around? I have to listen to your lungs. Thank you. Now take deep breaths with me, okay? In through your nose and out through your mouth. Perfect. Very good. You did amazing. Okay, so now I'm gonna take your blood pressure, okay? I'm just gonna be placing this cuff on one of your arms. If you can reach out an arm for me. Thank you. And now try to relax. Relax. relax, relax, relax. Okay. So your blood pressure looks normal. Very good. Very, 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 very good, very good, very good. Okay, so now I'm going to be checking the oxygen levels in your blood. Can you reach out a finger for me? Thank you. I'm going to be placing this on your finger. Let's see, let's see, let's see. Okay. So your oxygen levels look very good as well. Perfect, 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 perfect. Now I'm going to be checking your eyes, okay? So I'm just going to be shining this light into your eyes, and I would like you to look at the wall behind me. Perfect. Okay, so your pupils are dilating and contracting as they should, which is very, very good. But I want to get a closer look of your eyes. So I'm going to be using a very bright light, so beware, okay? Don't look directly at the light, okay? I'm just looking into your eyes, checking for any abnormalities. Okay, so that looks good. Your eyes seems okay, but I want to test something, okay? So if you can look at my nose. Perfect, and I want you to tell me which side is moving, okay? Good, 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 amazing, perfect, good, both. Yeah, that was both, okay? Now I would like you to let me know when my fingers enter your field of vision, okay? Good. Good. Perfect. Good, 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 okay? And now let me know when my fingers leave your field of vision, okay? Good. 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 Perfect, 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 perfect. Now can you follow my finger using only your eyes? Yeah, don't move your head, use only your eyes, okay? Perfect, 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 perfect. Okay, so what I'm gonna do next is that I'm gonna be testing your sense of taste. So I have this, and I'm just gonna be giving you this one. Put this in your mouth and let me know what it tastes like, okay? What does it taste like? Strawberry, very good. And now this one, put it in your mouth. What does it taste like? Vanilla, vanilla, very good. And the final one, put this in your mouth. What does it taste like? Banana, 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 banana. Very, very good. Okay, okay, okay. So now I'm going to be testing your hearing, okay? So I have these scissors right here, and I would like you to close your eyes. Close your eyes. Let me know which side you hear the scissors on, okay? Good. Good. Perfect. Good. 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 Amazing, 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 amazing. Okay, so now I'm going to be whispering some words into each ear, and I want you to repeat the words back to me, okay? Okay. Pillow, 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 pillow. Pillow, good. Computer, computer, computer. Computer, good. Light, 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 light. Light, good. Hairbrush, hairbrush, hairbrush. Hairbrush, very good. Cabinet, 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 cabinet. Cabinet, very good. Food, food, food. Food, perfect, perfect, perfect. Very good, very good, very good. And now I'm going to be testing your sense of touch. So I have this soft brush. And I have this rough brush. And I want you to close your eyes and tell me which brush is touching your face, okay? So close your eyes, close your eyes, close your eyes. Okay. Soft or rough? Good. Soft or rough? Good. Soft or rough? Good. Soft or rough? Good. Soft or rough? Perfect. Soft or rough? Good. Soft or rough? Good. Soft or rough? Very, 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 very good. Very good, very good, very good. Okay. So, the last thing that I'm going to be testing is your sense of smell. So I just want you to close your eyes, close your eyes, close your eyes. And I want you to smell this, okay? What does it smell like? What does it smell like? Coffee. Yes, very good. It's coffee, it's coffee, it's coffee. So now I'm going to be writing down the results. You did amazing, okay? And the conclusion is that you are in perfect shape. Okay, so thank you so much for coming in and for letting me examine you, and I hope you have a wonderful day or a good night wherever you are in the world.